Chairwoman Vargas. I will now call the May 14th, 2024 San Diego County Board of Supervisors special meeting for the group budget presentations, the Flood Control District meeting, In-Home Supportive Services Public Authority meeting, the Sanitation District meeting, the San Diego County Fire Protection District meeting, and the County Successor Agency meeting to order. As a reminder, according to the board rules and procedures, audience members shall not whistle, clap, stomp feet, or anything that disrupts the proceedings. On behalf of Chairwoman Vargas, I'll now call the roll. And before I do that, I would like to note for the record that Supervisor Montgomery Stepp has requested to participate via teleconference due to an emergency circumstance. As such, if approved, all votes will be handled by a roll call vote. With that, I will now call the roll. Supervisor Anderson? Here. Supervisor Montgomery Stepp?
Here.
Supervisor Desmond? Here. Vice Chair Lawson-Remer? Chairwoman Vargas, noting that she is here. The first item will be for the board to consider a request by Supervisor Montgomery Stepp to participate remotely. Supervisor Montgomery Stepp will state the emergency circumstance for the board's consideration, state whether anyone over the age of 18 is in the room with the supervisor, as well as their relationship to the supervisor. Then the board will consider a motion, second, and vote. With that, I'll turn it over to Supervisor Montgomery Stepp.
Thank you, Clerk. Yes, I am requesting to attend this meeting online due to an emergency circumstance. Had a family matter out of the state, and no one over the age of 18 or under the age of 18, either one, is here in the room with me.
Thank you so much. With that, is there a motion? Chairwoman Vargas has noted she is making a motion to approve. Is there a second? Supervisor Desmond is seconding. With that, all supervisors in the chamber, please vote. Chairwoman Vargas, that motion passes with all supervisors who are present in the chamber voting aye. With that, on behalf of Chairwoman Vargas, we'll now move on to item 1. This is the only item on the agenda for this meeting. It is the presentation of the Chief Administrative Officer's recommended operational plan for fiscal years 24 through 25 and 25 through 26. For the purpose of this meeting, we'll hear budget presentations from our 4 main groups: the Health and Human Services Agency, the Public Safety Group, the Finance and General Government Group, the Land Use and Environment Group, and from specific departments within those groups. If any of Chairwoman Vargas's colleagues have any comments or questions, those will be taken after we hear from each group and their departments. This will ensure that we get through all of the presentations in a timely manner. At the close of the presentations on Thursday, May 16th, 2024, we will invite the public to make their comments. At this time, I would like to provide comments on behalf of Chairwoman Vargas. And those comments will be shared on the screen as they're coming up. On behalf of Chairwoman Vargas, it reads, I want to begin by thanking Sarah, our group managers, department directors, and Ebony and the finance staff for working hard to come up with this balanced budget. I've always said that budgets should reflect our priorities and values and work for all of us. As currently proposed, the FY 24 through 25 budget is $8.5 billion, representing an increase of over $400 million from last fiscal year, and is the largest budget that has ever been proposed. As you'll hear from our 4 groups shortly, this budget makes significant investments to build community infrastructure, address our cross-border pollution crisis, maintain critical services, support mental and behavioral health services, and increase staffing to support important programs and county operations, to name a few. While this proposed budget represents an increase from last fiscal year, I do want to take a moment to acknowledge this is a period of economic uncertainty and volatility. The truth is that there may be difficult years ahead of us, especially as we face possible cuts in funding from the state of California and federal budgets. Because of this, it is critical for this board to anticipate this uncertainty in the year ahead and focus on the long-term sustainability of the programs we have invested in. The proposed budget focuses on ensuring the core critical services are provided to the region and that programs are aligned with community needs to provide continued services to our most vulnerable populations. It is also an utmost priority to view this budget through the lens of equity. I want to thank county staff for their improvement and use of the budget equity assessment tool in developing the financial forecast for this budget. Using tools such as this and prioritizing community meetings and engagement is a crucial step towards transparency and creating a budget process that works for all of us. It is crucial that every voice is heard to adopt a budget that truly reflects our community's values and addresses our region's most pressing issues. It is vital to me that as we review this budget, I ask our team members in the community, do the programs, project plans, and investments help to reduce disparities? Only together can we create a blueprint that serves our financial roadmap to continue building stronger and healthier communities. As we look at where this county is headed for the future, I want to express my commitment to continue to make decisions with equity at the center of our budget process. Thank you again for all of the work. And with that, I will now turn it over to Sarah to kick off with an introduction of this year's proposed operational plan.
Thank you, Chairwoman Vargas and members of the board. We appreciate the opportunity to present you with our recommendations for the 2024-25 budget. We are truly fortunate to call San Diego County our home. Here, our over 3 million residents and 32 million annual visitors have opportunities to live, work, and recreate in a region that includes beaches, mountains, deserts, and some of the most biodiverse environmental habitats in the nation. With our proposed $8.4 billion budget, our organization, with its over 40 departments and our 20,000 dedicated team members, will continue to serve the entire region with things like health and social services, food and restaurant inspections, beach water quality testing, elections, protective services, and much more. And we won't stop there. In our unincorporated communities, we will provide all these services, as well as city-type services, such as fire protection and maintaining roads and flood control districts, to libraries, parks, law enforcement, and land use decisions that will shape our communities for generations to come. Every day, we endeavor to meet the diverse needs of our region, striving toward a future that's just, sustainable, and resilient for all. We are a work in progress, and there will always be more to do in our forward movement towards more equitable and sustainable programs, policies, and practices. The reality is we are facing complicated economic times. In understanding this, we kept the board's vision in sight as we've drafted this year's proposed budget to mirror the values and priorities of the board. We have worked together to carefully evaluate the impacts of state budget cuts, while navigating the complexity of what type of effects tougher fiscal times might have on our programs. We rooted our recommendations in our organization's core values: belonging, equity, access, sustainability, integrity, and excellence, with the purpose of presenting a budget that reflects our commitment to our community. The recommended budget not only maintains essential services, but also drives meaningful change in crucial areas that impact our community. Housing is one of the most pressing issues of our time. You'll see investments to reduce homelessness and create housing affordability for all income levels. This budget continues to invest in safety net programs that help more than 1 million vulnerable residents, ensuring access to programs like CalFresh and Medi-Cal to make sure community members have the food, health services, and financial support they need. It invests in behavioral health and substance use disorder treatment for individuals, and prioritizes public safety in ensuring a fair and equitable justice system, while investing in programs like alternatives to incarceration and others that help provide opportunities for justice-involved individuals to reshape and improve their paths in life. We remain committed to sustainability and reducing the impacts of climate change by targeting a 90% reduction in carbon emissions from county facilities by 2030. Along with investing in watershed protection, more public electric vehicle charging stations, and planting thousands of trees. And we'll continue investing in public infrastructure with funding for roads, buildings, parks, and other community enhancements. All this work cannot happen without our county team. They are the heart and soul of all we do. This budget invests in our team, the county's 20,000 staff members who make our work possible. The budget recommendation totals just over $8.48 billion for fiscal year 2024-25, with more than 20,400 staff positions. This is an increase of about $318 million, or just under a 4% increase from our current year's budget, and adds 72 positions. While this recommended budget includes significant investments to support the health, safety, and resiliency of our communities, especially some of our most vulnerable neighbors, it also reflects a slowing of growth in comparison with our recent past. For example, our 4% overall budgetary increase marks a slowing from 11% between the 22-23 and 23-24 fiscal years. And our 0.35% increase in staff is significantly lower than the 3% average over the last 5 years. Understanding the complexities of the economic slowdown compared to the past and looking at projected trends in the next fiscal year, the county team approached the recommended budget in a way that prioritized core services and mandated programs while making sure to focus on what our community members in the county need the most. This strategy helps to keep resources steady by bridging gaps between costs and revenues and using reserves when needed. These decisions on funding priorities are not easy, but they are made to assure a balanced budget and that the county can continue to meet the needs of our residents over the longer term. This includes sustaining core county services, prioritizing mandated programs, meeting obligations to operate capital facilities that will open soon, while limiting our overall capital projects through our CENA. We anticipate future years to present additional needs for resource prioritization, and we are preparing now to ensure our county team continues providing vital services and programs. In other words, our current approach looks to mitigating risk beyond next year's budget to position us for the long term by planning around the use of reserves. I want to extend my sincere gratitude to the entire team for their tireless efforts in crafting this proposed budget. From our elected officials, departmental, operational, and support staff, to group finance directors, chief operations officers, general managers, and our chief financial officer, along with the Office of Financial Planning team, everyone has played a crucial role. This collaborative effort underscores our commitment as the one county team to both our communities and our organization, and I deeply appreciate everyone's contribution. You will hear more from the groups and departments in their presentations today and Thursday about the innovative programs and investments that support the community, as well as how they have evaluated their current resources to leverage new investments for core services while absorbing existing needs and even deferring or suspending some requests for growth in programs to future years. I will turn it to Ebony Shelton, Chief Financial Officer and General Manager of the Finance and General Government Group, who, along with the county's other general managers, Eric McDonald, Holly Porter, Davia Lynch, will lead the presentations regarding our proposed budget. Ebony?
Thank you so much, Sarah. Good morning, Chairwoman Vargas and members of the board. We're here today to provide an overview of the CAO's recommended operational plan for fiscal years 2024 and 25-26. This is the county's budget for the coming fiscal year, which will come before the board for consideration and adoption in June. All that we do in this county is tied to our overarching strategic goals. And one overarching theme that stands out from this budget is simply building stronger and healthier communities. We see this theme delivered throughout the budget in 4 primary ways. Community infrastructure, we're investing in the community through an equity lens. Health and education, we're prioritizing health equity. Economic prosperity, we're empowering innovation for future growth and opportunity. Climate and environmental justice, we're focusing on climate sustainability and resiliency. With the theme of this budget in mind, let's consider the specifics of the county's strategic initiatives. These initiatives set the stage for how the county spends money. The wheel on the left details the county's general management system, which is our business model and values, noting that community engagement is at the heart of all that we do. The commitment to these values will be reaffirmed throughout the presentations that you hear today and Thursday, because what we're doing throughout this budget process is listening to the community and then investing in our community. In developing the recommended budget for this coming year, the strategy has 4 primary goals. First, with this budget, we want to prioritize the county's core services that residents rely upon. People rely upon county services for health and social services, for community safety, to provide places for learning and recreation, and so much more. Second, we'll also strengthen existing obligations to the community while preparing for potentially difficult budget years ahead, and we'll do that by advancing resiliency within our county. And we can help to advance big problems like homelessness, housing crisis, behavioral health, and substance use disorders. And we can bring about justice reform, impact climate change, and stimulate equity. Third, growth in this budget is possible by maximizing resources and using alternative sources of funding, including one-time funding from the General Fund Reserve, as well as advancing the anticipated use of FEMA reimbursements. And finally, we need to stabilize our future revenues. The county will continue to support its commitment to labor, capital infrastructure, and retirement through stabilization strategies. We'll also prioritize our programs as needed to ensure that we have stable service delivery. And to help us do that, we'll implement a bridge funding strategy utilizing our unassigned fund balances, which we'll discuss in more detail a little bit later. For now, let's review the fiscal year 24-25 budget in a little more detail. Overall, the recommended budget is increasing by about $318 million, or just under $8.5 billion. This is a 3.9% increase from the county's current fiscal year budget. Our county budget has invested an additional $2 billion in our region over a 5-year span, as you can see in this trend line on the right at the top of this chart. The budget increase this year is across all groups due to negotiated labor agreements and increases for funding for public safety and justice reform, infrastructure investments including parks and roads, behavioral health, homelessness, housing, and other services for people in need, public health and protection, environmental sustainability, and other priorities of the board and in each district. As we transition to staffing, I want to highlight the growth of staffing over the last 5 years since fiscal year 2021. See the trend chart at the top on the right. Note here, staffing has increased by 2,500 staff years since 2021. And while our pace of growth in this budget cycle has slowed, we continue to carry out those programs and to provide services that were established or grew over those past 4 years. In the upcoming budget year, we're continuing to recommend investments in mandated programs, board priorities, and capital facilities that have been built and have dedicated funding sources. Shifting to the staffing changes by group for the next fiscal year, total staffing is increasing by a net of 72, or about 0.5%, to a countywide total of 20,459 staff. You'll hear more details about each of these new staff and how they'll be utilized over the remainder of today and Thursday. At this point, I'd like to transition to talk about how the board's discretionary revenue, or general purpose revenue, is being recommended to be allocated. General purpose revenue is increasing by 8% to $1.9 billion. The general purpose revenue increase is the result of economic growth in several areas positively impacting the county, notably in the housing market, reflecting an expanded assessed value growth, as well as higher interest earnings and increased sales and use tax receipts generated by activity in the unincorporated area. As you know, general purpose revenue is the board's largest discretionary revenue source. This budget recommends the largest year-over-year increases in general purpose revenue allocations to support public safety, then the Health and Human Services Agency, followed by the Land Use and Environment Group and the Finance and General Government Group. However, as you can see in this chart, the largest total share of general purpose revenue is being invested in the public safety group. Before I wrap up, I want to highlight how we balance the recommended budget and then take a longer-term look at the budget potential risk and mitigations. During our forecasting process in the fall, we presented to your board that we had an outlook for 24-25 that had resources of $142 million in excess of what we had in anticipated revenues. This was comprised mostly of expenditure growth, but also due to projected revenue shortfalls, as you can see in the left part of this chart. We were able to balance the recommended budget through a series of actions, including prioritizing programs, the allocation of revenues, operational efficiencies, and through the use of available one-time resources from various trust funds or other dedicated funding sources. I'll note that this chart is from a point in time and from a county-wide perspective. As groups present their information over the next 2 days, they may have additional information or slightly different context to explain their strategies and where each group is at in their effort to mitigate current and potential future gaps. With that said, these steps helped us to recommend a balanced budget for 24-25. However, future risk remains. Within the general fund, we are expecting a $63 million gap in the following fiscal year 25-26. Unfortunately, the outlook doesn't get better, ultimately growing to a $93 million ongoing gap by fiscal year 28-29, primarily the result of revenue shortfalls, but also some projected expenditure increases. What I'm most concerned about are the revenue shortfalls, because this is something that we can't necessarily control when it occurs due to legislative or economic conditions. Next, I want to walk us through a sensitivity analysis, and I'll start by defining what is on this chart from top to bottom. The solid black line that you see here on this chart represents expenditures, and the blue shaded area represents unassigned. The blue shaded area represents health realignment revenues. And the gray shaded area represents, or green shaded area, excuse me, represents one-time health realignment. The solid orange line represents ongoing general purpose revenue and sales tax revenue. We're showing this chart to provide the board with an analysis of the projected gap in mitigation strategies. Ideally, what you see here with the orange line and the black line, they would be aligned or equal. As you can see, they're not. And what you see here is in the shaded area, the one-time health realignment that has been used as an ongoing past practice, quite frankly, for as long as I've been here doing budgets with the county. It's always been a known risk that the county has monitored. Health realignment is funded by key sales tax revenue, and we're in an economic environment where this risk may require additional bridge funding or unassigned fund balance, which is what you see in the green. The green represents the unassigned fund balances that would be needed to bridge that gap until those sales tax revenues can fully recover. Even with the unassigned fund balances, though, we are still left, as you can see, with a $63 million gap in fiscal year 25-26. One thing this chart does not show is what could happen if the economy performs better or worse than what's expected. If sales and property tax revenue, for example, comes in 1% higher or lower, this could yield an additional $25 million in revenue to help mitigate the gap in future years, or conversely, revenues could also be lower to that same degree. So let's look a little bit more at our recommended bridge strategy on the next slide, assuming that there are no changes in revenue moving forward. To mitigate our future gap, we have a bridge funding strategy to align with when we anticipate revenue shortfalls like the realignment and other statewide sales tax revenue to fully recover. Bridge funding means that we're applying temporary one-time funding to ongoing revenue sources where we anticipate shortfalls in future years to bridge the gap until those revenue sources can fully recover. This strategy allows us to maximize our resources and continue to provide and prioritize services. Without bridge funding, the county would not be able to provide services at the current levels. This strategy may change, I'll note, as we go year to year based on how the economy actually performs and recovers. But as of right now, this is what we're planning and solving towards. In these final few slides, we'll wrap up with a look towards the future, as well as a few budget dates. The governor released his revised state budget proposal just late last week, and we're all in the process of currently reviewing for impacts to the county. You may hear some preliminary reports from the team today and Thursday. And to set that up, I wanted to provide you all with a brief snapshot of the magnitude of the state budget based on the latest economic forecasts, changes in population, as well as caseloads. The total budget, including the general fund, special funds, and debt, is $288 billion, and the deficit is $44.9 billion. When the budget was first released in January, there was a known deficit of $37.9 billion. And prior to the release of the May revise, there was early action in a budget agreement which through $17.3 billion of the budget problem had been addressed. However, after the release of the May revised budget, the deficit grew by an additional $7 billion due to lower income tax revenue and the IRS extending the tax filing date due to the winter storms. The state plans to address its deficit through a series of reductions, pauses in programs, borrowing, and other mechanisms. And we'll continue to monitor the impacts from the state budget deficit. This is a serious risk to our county, as much of our revenue comes from the state. Now that we've briefly covered the state budget, I want to also touch on some other risks and discuss some mitigation strategies. We must always consider the potential impacts of retirement, workforce, and our local economy. Retirement returns are smoothed out over multiple years, but are dependent upon market returns, which can be volatile, and we monitor closely. When it comes for our workforce in 25-26, contracts for our general members will be expiring soon. As we look even further down the road, we have a capital improvement needs assessment, which calls for $1.2 billion of investments over 5 years. As we think about how to mitigate some of these risks or plan for them, I'll start by acknowledging that how our county has faced trying times. To help ensure that we're set up for success, we're taking further efforts to plan for disasters. We're proposing to set aside $20 million, $5 million to address capital, information technology, and emergency response efforts across the enterprise, as well as a $15 million appropriation for contingencies, of which transfers and revisions can be made by a four-fifths vote of the Board of Supervisors. If these funds aren't used or are only used on a one-time basis in the coming year, they could be available to help us for solving for the 25-26 budget gap. However, if these funds are used on an ongoing basis, then this will limit our capacity in future years. Moving forward, we'll continue our countywide stabilization strategy for labor, capital, and retirement, spending ongoing amounts on a one-time basis until those amounts are depleted. And we've noted the $63.5 million gap for fiscal year 25-26. While we're working to slow discretionary growth, including staff growth, while making every effort to prioritize board priorities. This will include a deep review of service levels and potential service level adjustments as we head into 25-26. When it comes to infrastructure, we want to continue to maintain what we have so we can provide excellent service for our customers and places of work for our employees, and when possible and financially sustainable, to add to our portfolio of assets. At the start of this fiscal year, we began a careful review and evaluation of the projects that were included in our capital improvement needs assessment to ensure that only those projects that were realistically going to be initiated within the 5-year period were recommended for funding. We plan to continue this practice moving forward. And finally, we will strategize to increase operational efficiencies, with our goal being to ensure that county operations have less reliance on unassigned fund balance to the fullest extent possible, potentially reforming programs as needed to make certain that there's no ongoing reliance on funding sources that won't be available in the long term. Finally, I want to close with a few of the key budget dates. A critical part of the budget development process is engaging with the community so that we can get their thoughts and priorities as the board moves towards adoption of the final budget for the coming year. Some community engagement activities, including pop-up outreaches in each district, which aren't listed necessarily here, but they were very successful. Starting next week, we'll host an in-person community meeting, open house style. Instead of a presentation, it will be where people can talk directly with experts who can answer questions about topics that they care most about. And we'll follow up a week later with a similar community meeting on a virtual platform to broaden our reach across the vast county. We'll have additional opportunities for the public to provide feedback to the board, including the June public hearings and budget deliberations on June 25th. Thank you for your time, and I'm happy to answer any questions.
Thank you. On behalf of Chairwoman Vargas, I want to thank Ebony for the presentation. I'm going to now proceed with reading Chairwoman Vargas's comments. They read, I want to take a moment to thank the county staff for their hard work in preparing these presentations and the budget document. I would like to highlight that this is the first time the tribal land acknowledgement has been included in the county operational plan. Since becoming the chairwoman last year, I made it a priority to start every board meeting with the tribal land acknowledgement. By recognizing the historical injustices of the land that we sit on, is a step in the right direction towards transparency, equity, and respect with our tribal partners. I'm glad to see that this practice has been included in the county operational plan, and I hope to see that this is being implemented at all levels of county government. I also want to highlight the importance of the investment in our county workforce through a much-deserved increase in salaries and benefits. I look forward to hearing from our group presentations today and Thursday and the investments and efforts to address the cross-border pollution crisis in the Tijuana River Valley. I want to acknowledge that we have made significant strides towards investing in our behavioral health system, including in the behavioral health workforce development and behavioral health treatment under Senate Bill 43. I look forward to hearing from our HHSA team on the investments toward this. On behalf of Chairwoman Vargas, are there any comments from her colleagues in the budget overview? Okay, we will now hear from, hand it over to Dr. Eric McDonald to present the Health and Human Services Agency budget.
Good morning, Chairwoman Vargas and members of the board. The Health and Human Services Agency delivers essential health, housing, and social services that make people's lives healthier, safer, and more self-sufficient. At its core, the agency carries out programs that make up the social safety net for the most vulnerable members of our community. Many services are state and federally mandated. These include public assistance programs, assessment and protection for children and adults, public health and behavioral health activities, and more. Other services have been directed by the board or have been established with best practices in partnership with the community. The Integrated Health and Human Services Agency was established more than 25 years ago. Our 8 service departments, hopefully noted here on a slide that'll be up in a second, There we go. Our 8 service departments noted here focus on services for older adults and persons living with disabilities, behavioral health and substance use disorder services, child protection and prevention services, supports for traditionally under-resourced groups, including people at risk of or experiencing homelessness, affordable housing and community development for low-income households, nursing, pharmacy, and medical services, preventing injuries, disease, and disabilities, and self-sufficiency programs. The agency also has administrative support departments that ensure service delivery is cost-effective, efficient, and comprehensive. During today's presentation, we will discuss in depth the departments indicated with an asterisk on the slide. I am joined by their respective directors, Dr. Kim Giardina, Rick Wani, David Estrella, Barbara Jimenez, and Dr. Luke Bergman. The directors of all the agency departments are also here should you have questions for those not formally presenting this morning. But first, I'm pleased to share some agency-wide accomplishments during the current fiscal year. I will follow that with an overview of the recommended agency budget and upcoming priorities. This past year, the agency team continued to do what it does best, provide timely, essential services to more than 1.3 million people. That's more than 1 in every 3 county residents. We are committed to being responsive to the immediate needs of the people we serve. We strive to be timely and person-centered in answering calls, completing application reviews and notifications, and conducting assessments. This year, we enrolled record numbers of people in Medi-Cal, CalFresh, and other self-sufficiency services. New facilities were opened to provide behavioral health programs, social services, and housing. We also advanced the framework for ending homelessness by starting new programs across its 5 strategic domains of prevention, diversion, outreach and services, emergency housing, and permanent housing. And we have begun the reimagining of child welfare services by focusing on prevention and family strengthening with the new Child and Family Wellbeing Department. We've expanded our formal partnership with San Diego State University under the Live Well Center for Innovation and Leadership to prioritize efforts such as ensuring a well-trained workforce that represents the diversity in our community. Our partnership also supports a robust research strategy that complements the county annual strategic research plan. The county oversaw the delivery of 1.6 million meals to address senior food insecurity and social isolation. We provided in-home support services, known as IHSS, to 40,000 recipients. County public health centers helped 20,000 patients with 100,000 health services. The Live Well on Wheels mobile office rolled out to more than 450 events throughout the county. Public Health Services was recredited this year at the highest level, recognizing operational excellence across all programs. These ranged from disease prevention and outbreak response to providing case management services to almost 19,800 children with chronic illness or disabilities. Our public health team also facilitated an enterprise effort to develop the new county sustainable, local, and equitable food policy and program. The successes of these efforts are made possible by the work of our dedicated staff, ongoing evaluation efforts, and engagement with the community. Speaking of the community, we expanded our connections through more than 2,100 specific engagement events since last July. In doing so, we interacted with nearly 140,000 people at these activities, sharing not only critical resources, but receiving feedback to improve and direct our services. In times of emergency, agency staff increased the delivery of essential services to people in need. The agency played a significant role in the county's storm response and recovery efforts. Our staff helped lead the establishment of a local assistance center and supported the City of San Diego's Assistance Center. We approved 12,800 disaster CalFresh applications totaling more than $5.7 million in benefits. Hundreds of agency employees took on additional duties to help flood victims. Our staff supported people at Red Cross shelters and FEMA disaster recovery centers. They also reached those in need through our existing network of family resource centers, the Call Access Center, and Live Well on Wheels locations. The agency supported the creation and operation of the county's unique emergency temporary lodging program. And today, we continue to provide housing navigation to help displaced families transition to a home. Many other events and shifting mandates impacted our work this year. The cost of living, especially housing, has continued to rise, putting more pressure on the people we serve. Demand for safety net services soared. When the federal public health emergency waivers related to COVID-19 ended, our staff helped hundreds of thousands of residents renew their Medi-Cal coverage for the first time since the renewals were halted during the pandemic. The end of Title 42 and surge of asylum-seeking migrants impacted our region. Agency staff partnered with community organizations and county departments to support thousands of new arrivals. And lastly, new state mandates such as the CARE Act program and Senate Bill 43 brought behavioral health opportunities, yet also required substantial investment of planning and resources. We achieved strong outcomes this year because we made significant investments in prior years to strengthen the service delivery system. Many of these were paid for by additional federal and state funding that prioritized specific mandated programs. Now, as we previewed in last year's budget presentation, and as the county's chief financial officer just discussed, we are facing budget gaps. These gaps are opened by overall increases in costs, rising needs, slowing revenue streams, and the ending of one-time resources like ARPA. Availability of state and federal funding resources are especially significant for the agency because, as you can see, they make up 85% of our revenue. That includes almost $880 million in realignment revenue generated from sales tax receipts and almost $300 million in Mental Health Services Act revenue that comes from personal income tax receipts. A relatively lower proportion, 9%, of the overall agency budget is funded by local dollars. Individual departments within the agency have a relatively consistent reliance on federal and state revenue rather than local funding. While we included mitigations and one-time bridge funding in the recommended operational plan to account for slowing revenue streams, we knew that the outcome of the final state budget process could necessitate additional adjustments. As mentioned last Friday, the governor released the summary of his May revised budget earlier than expected. We anticipate the detailed table supporting the summary to be released today, which will allow us to learn more. While we still have work to do to understand the full implications of the May revise, the information we have from the available summary indicates potentially significant impacts for the agency and the communities we serve. The May revise proposes eliminating $300 million in ongoing statewide funding that has allowed local health departments to strengthen the public health workforce and infrastructure. Locally, this annual funding supports $14 million built into our proposed budget for positions across 5 health branches, public health branches. We are already working closely with the Office of Economic Development and Government Affairs in advocating to protect this funding. Reductions are also proposed by the governor across various support services provided in CalWORKs and in child welfare program areas, including employment services and housing supports. Behavioral health grant funding opportunities appear to be impacted as well. There are also potential reductions in allocations to supporting administration of programs in adult protective services, Medi-Cal, and other programs. Another significant proposed budget cut is in state affordable housing program developments, which could impact dollars available to leverage locally. So as we present this recommended operational plan today, we acknowledge that we will need to make adjustments as the state budget is finalized over the next month and a half. This slide shows a 5-year look back on staffing. While we experienced significant full-time employee growth over the last few years, our proposal is to hold position growth essentially flat due to the fiscal environment we are entering. The recommended budget continues investments in our current team and proposes an increase of 10 positions that we anticipated will be fully funded with federal or state program revenue. These include new positions, 4 positions in aging and independent services to expand senior nutrition services and to help more veterans who are at risk for nursing home placement. There are 2 positions in housing and community development services to support housing choice voucher programs. And we also have 4 proposed positions in public health services to deploy 2 new Live Well on Wheels vehicles. It is worth noting that these 4 positions are currently proposed to be funded by the health dollars slated for reduction in the governor's May revise. I want to highlight that position requests from our departments were much greater than the 10 new positions in the proposed budget. We were unable to add those positions given the budget constraints. We have worked hard to keep previously budgeted positions filled and to hold our vacancy rate down in a challenging labor market. Last year, similar to the county overall, the agency had a vacancy rate in the double digits. Today, our vacancy rate is just over 4%. This has been accomplished by hiring over 1,100 new employees, many through same-day hiring at community job fairs. As you will see in the same 5-year look back, we have this time a focus on total expenditure appropriations, where we have significant investments largely based on federal and state funding. The proposed increase in expenditures this year is $243 million. This is down from last year's increase of $383 million. On this slide is the total agency budget of $3.4 billion by department. You'll be hearing from the top 3 departments, self-sufficiency, behavioral health, and child and family well-being in just a moment. 40% of the additional $243 million is in salaries and benefits across all departments. While this amount is largely tied to negotiated labor increases, it also accounts for an overall vacancy rate that is lower. Our goal remains to keep vacancy rates as low as possible in order to maintain high service delivery standards. We may need to revisit vacancy rates depending on the allocations of the state administrative funding in their final budget. The remaining 60% includes investments tied to dedicated funding to further develop the behavioral health continuum of care. Dr. Bergman will be reviewing these in detail later this morning. The budget also reflects board action to invest an additional $10.6 million into the Innovative Housing Trust Fund sourced by the Evergreen component of the ARPA framework. The budget accounts for successes in pursuing grants, such as an increase in almost $8 million in funds to address the needs of those experiencing homelessness within the San Diego Riverbed and Plaza Bonita areas. The budget includes increases mandated by the state in self-sufficiency services for the growth in the General Relief Cash Assistance Program. Aging Independent Services budget rose to fulfill mandated increase in the county's share of in-home support services, including reflecting previously negotiated IHSS provider wage increases. These adjustments bring the total IHSS budget to over $200 million. This chart is another visual representation of the proposed budget that reflects the increases, and in one case a decrease, compared to this fiscal year. For the most part, you'll see on the left-hand part of this, or the right-hand part of this chart, increases across all departments in the last column, which will include the need to cover salary and benefits that I mentioned earlier. The largest increase, third from the top, is in behavioral health services, reflecting dedicated funding for mental health and substance use services. There is one decrease shown near the bottom of the table in housing and community development services. This reflects reductions to account for completion of prior year one-time affordable housing investments. However, this is offset by the new infusion of funding into the Innovative Housing Trust Fund, as well as increases supporting multifamily rental housing in the unincorporated area. Our focus remains on prioritizing equity through core mandated services and programs, and sustaining prior investment that advanced service delivery. This chart is also available in the operational plan, and you'll be getting more details in the upcoming departmental presentations. While there are still funding opportunities, the reality is we turned to several one-time mitigation steps this year to balance the budget. We did so focusing on strategies that would have the least potential disruption to core service delivery. While we are proposed to receive a new allocation of $17.5 million in local funds for mandated costs in general relief, we still had a significant gap. We had to find additional ways to cover salary and benefit increases, rising costs of doing business, and projected fiscal year 24-25 realignment shortfalls. Most significantly, we are proposing the use of one-time funding to bridge essential ongoing services. This includes the use of over $100 million in one-time available realignment funds based on sales tax receipts from prior years. By committing this amount, we are projected to exhaust all available one-time realignment funds carried over from prior years. We will continue to work with the enterprise effort on the bridge plan reform strategies referenced in the previous presentation. Revenue strategies are another major mitigation tool. We are proposing to draw down an additional $10 million per year over the next several years in tobacco settlement funds to avoid cutting certain behavioral health services expenses. Under this strategy, the tobacco settlement fund would be estimated to be depleted by fiscal year 2033-34. We will also continue to pursue any additional opportunities to build Medi-Cal. For example, our proposed budget includes a projection of $1 million in new Medi-Cal funding from billing for mobile crisis response team costs previously covered with realignment revenue. We reviewed all areas in the existing budget where appropriation could be repurposed to absorb cost increases. This includes aligning to current service utilization levels and reviewing various program support functions where we could free up funds by innovating without impacting core services. Amounts shown as suspended on this slide represent initial requests by departments which get refined and deferred throughout the 5-year planning and budget process. In order to focus on preserving existing core services, many departmental requests were not included in the recommended budget. These requests were primarily in the areas of position growth and locally funded behavioral health service expansions. The departments will speak further to the impacts in their presentations. Suspending position growth in areas like in-home support services and self-sufficiency services where caseloads are continuing to increase will mean that our service levels will drop to align more closely but still exceed state requirements. Currently, we exceed standards like timeliness for application processing and answering calls. The agency will also continue to partner with all groups across the enterprise to re-envision and re-engineer how services can be provided and where efficiencies can be achieved. For the agency, this will include further efforts to consolidate our facility footprint and re-engineering programs to enhance revenue, such as through our various nurse home visiting programs. We will also continue to maximize revenue opportunities under behavioral health payment reform. At the same time, while pursuing strategies to protect current services, we will continue to work to mitigate revenue shortfalls, including those proposed in the May revise that could necessitate hard decisions to reduce programs. Despite being limited in where we could expand the budget, we were able to prioritize protecting and moving forward with programs that advance equity and align the needs of underserved communities using anticipated funding streams. The agency budget reflects the budget equity assessment, year-round feedback from community engagement, and ongoing program evaluation. We use this information to focus on advancing core mandated services and programs. The equity assessment, for example, supports the $2 million expansion of the San Diego Veterans Independent Services and at Any Age Program, or SD Visa. That's a tongue twister. This program helps veterans who are at risk of nursing home placement remain living safely in their homes. The assessment also reinforces the need for adding staff to drive the two new Live Well on Wheels vehicles to be deployed next year. This will provide greater opportunity for public health services and other HHSA programs to reach those who may have limited transportation or live in more rural communities. To address food insecurity, public health services will continue to administer CalFresh healthy living programs. One of the many programs under this umbrella is focused on increasing availability of produce sourced from local farms in neighborhood markets. The budget also supports sustained investment and partnerships with the public safety group to improve the health and well-being of justice-involved individuals. As we look ahead, this budget invests in equitable access and expanded services under the behavioral health continuum of care. It will advance housing and efforts to prevent and end homelessness, like the implementation of the new Homeless Solutions and Prevention Action Plan. We have resources to continue strengthening public health infrastructure to prevent the spread of disease, such as the completion of our new public health laboratory. We will continue to invest in identifying ways to maximize our resources and increase regional collaboration, like leading Medi-Cal transformation locally and supporting regional street medicine initiatives. The implementation of new mandates is also a sustained focus, and we will seek out new revenues to meet those mandates. In closing, we are proud of this, that this proposed budget addresses the regional critical service needs of our most vulnerable populations. Although we're planning for more mitigations and possibly more tough decisions ahead based on final funding amounts that will be included in the state budget, we are fully committed to providing excellent services to help people live well. We appreciate your continued support for our essential safety net programs. And now I'd like to turn it over to our directors, who will speak more specifically about each of the departments. starting first with Dr. Kimberly Giardina from Child and Family Wellbeing.
Thank you, Dr. McDonald. The Child and Family Wellbeing Department was recently created in 2023 to transform the way child protection services are provided to the community with a focus on equity and supporting families. We have had an exciting and productive first year. Child and Family Wellbeing integrates First 5 San Diego, child welfare services, child care services, and other critical resources to partner with children, youth, and families. As the number of children in foster care becomes significantly smaller, we strive to make foster care a support to families, not a replacement for them. Child and Family Wellbeing is composed of 2 program areas. The Office of Child and Family Strengthening includes prevention and early intervention services provided by First 5 San Diego, child care initiatives, and prevention efforts supported by the Federal Family First Prevention Services Act. First 5 San Diego promotes the health and well-being of young children and pregnant individuals during the most critical years of development, from prenatal to 5 years of age. Prevention and early intervention services links families to resources so that all children are safe, all families are nurtured to build protective factors, and systems create equitable pathways to wellness. Our child care system increases and strengthens child care provider capacity and provides equitable access to the region's quality of early childhood education and care. The Office of Child Safety includes services offered by the previous child welfare services, such as identification, intervention, and treatment of child abuse and neglect. The Child Abuse Hotline receives and responds to reports from the community about the safety and well-being of children 24 hours a day, 7 days a week. A.B. and Jesse Polinsky Children's Center provides 24-hour temporary emergency shelter care to children birth to 17 years of age who are separated from their families for their own safety. For children in foster care, social workers work closely with the courts and legal partners to support a kin-first culture, meaning we strive to place children with relatives whenever possible and provide services to reunify families, ensuring the child's well-being and safety are at the forefront. Extended foster care provides continued care benefits and services to youth ages 18 to 21 to support their transition toward adult independence. And the San Pasquale Academy provides a multi-purpose continuum of care campus to meet the diverse needs of youth. This includes comprehensive resources to foster youth ages 12 to 19 with a stable and caring home, quality individualized education, and the skills needed for independent living. Child and Family Wellbeing has an amazing team of staff that work hard every day to improve the lives of children and families. I would like to highlight some of our staff's accomplishments. In the Office of Child and Family Strengthening, we have our Family Income for Empowerment program, which is an ARPA-funded program and is the second in the nation guaranteed income project aimed at reducing entries into foster care. Family Income for Empowerment is a $7.5 million investment, and the program began issuing direct cash payments to families in August 2023. Set up as a randomized control trial, the study will determine if cash payments are effective in reducing entry into foster care for families who have concerns for child abuse and neglect. There are 244 families currently receiving payments of $500 per month. And CFWB is partnering with the Office of Evaluation, Performance, and Analytics, or OEPA, on the evaluation of this program. The Child Care Workforce Investment Program is also an ARPA-funded program and has been accepting applications for retention stipends from child care providers, with 3,068 applications received so far. Priority stipends will go to child care workforce members operating in local child care deserts. Recipients will also receive a 2-hour virtual professional growth session. CFWB is currently in the procurement process for the Prevention Hub. The hub will offer all families a connection to an array of prevention resources, networks of support, and services. The goal is for it to be easily accessible near places where people live and work, with potential future options such as a call center, drop-in locations, extended hours, and home visits. We plan to have the hub operational by summer 2024. In October 2023, the San Diego Child Care and Development Planning Council, also known as the Local Planning Council, adopted the Child Care Blueprint as the council's guiding plan. So far, we have launched the Workforce Investment Program, Shared Services Alliance, and Cost Estimation Model. The Local Planning Council is establishing the next strategies to be prioritized and implemented. For our Office of Child Safety, we investigated about 20,000 allegations of child abuse or neglect. Our A.B. and Jesse Polinsky Children's Center cared for an average of 64 children each month. We provided services to 1,825 youth in foster care and adoptions. Extended foster care supports 230 youth, and San Pasqual Academy serves 52 foster youth. Fostering academic success in education is a board-created partnership with local school districts to improve the educational outcomes of middle and high school-age foster youth. Currently, 55 youth are enrolled. The evaluation of the first 3 years of this program shows statistically significant improvements in GPA, reductions in absences, and improved placement stability. In the 22-23 fiscal year, we successfully reduced the number of children in care by 9% and are on track for a 10% reduction this fiscal year. The number of African American children in foster care reduced by 19% last fiscal year, and we are also on track for further reductions this fiscal year. Looking ahead, Child and Family Wellbeing plans to build upon our many successes and the great work of our staff. Following a statewide movement to shift from mandated reporting to community supporting, we will be implementing a Community Response Guide, or CRG. The CRG is an online decision support tool for community members when they're trying to decide if they need to file a report to the Child Abuse Hotline or not. The tool provides clear support and guidance for reporters. It will enable Child and Family Wellbeing to receive the most appropriate reports and families to receive the most appropriate intervention. The Child Abuse Hotline online mandated reporter portal will be going live July 1st, 2024, after a successful 9-month pilot. Mandated reporters will now be able to file non-emergency child abuse reports online. This will help reporters submit reports more efficiently and helps our child abuse hotline screeners focus on the highest risk calls. We also continue our focus on building a kin-first culture. The research is clear. Children placed with kin have reduced trauma, higher placement stability, preserve lifelong connections to culture and community, and overall have better outcomes. As such, we have taken several steps and partnered with entities like the Harvard Government Performance Lab and the Center for Excellence's Accelerator Project to increase the number of kin placements. As previously mentioned, the Prevention Hub is an investment of $2 million and will link families to primary, secondary, and tertiary prevention services. Families referred to the hub will be provided with a care navigator who completes an assessment and connects the family to appropriate community-based services. We will also further the work of the Child Care Blueprint in conjunction with the Local Planning Council as they determine which strategies to prioritize next. In support of our county's strategic plan, Child and Family Wellbeing has made several key investments. For sustainability, we converted all active cases to electronic records. Finalized adoptions cases and other non-case record documents are next to be imaged, and closed files will continue to be imaged on a regular basis. To focus on equity, we will invest $2 million in prevention services available to families as previously highlighted. We are expanding options for families to enroll in evidence-based practices, such as parent-child interaction therapy and Healthy Families America. To empower, we are focusing on the results of our employee engagement survey. Child and Family Wellbeing held several focus groups with staff to gather more input about how best to increase employee engagement. We are working closely with staff and agency HR to establish more ways for staff to provide feedback and tracking follow-up to ensure staff know what action was taken. For our community, our team continues to meet regularly with community partners through monthly Faith in Motion activities, equity and justice partner forums, town halls, recruitment activities, and resource parent events. For justice, we focus on children who enter foster care, ensuring that we can achieve permanency for our youth, either through reunification with their families or through guardianship or adoption. Child and Family Wellbeing continues to increase the number of children and youth achieving permanency within 12 months. Locally and nationally, child well-being agencies serve a disproportionate number of families of color and families living below the poverty line. Child and Family Wellbeing prioritizes programs that address these inequities. Based on the Budget Equity Assessment Tool, we are proposing an increase of $1.9 million for the American Rescue Plan Act community-based child abuse prevention, which funds direct prevention services and planning activities, including the Prevention Hub. An increase of $2.3 million for the Transitional Housing Program Plus, associated with Housing Navigator and other enhanced funding to match increases in rental market rates. We are utilizing creative strategies to help support youth exiting care to find and remain in stable housing. Additionally, new funding received from the California Department of Social Services will be used to build capacity by adding more therapeutic foster care options for children and youth with complex needs. The Child and Family Wellbeing budget is recommended to grow by $22.2 million to a total of $479 million, primarily associated with the Office of Child Safety. Our positions are recommended to increase by 2 full-time equivalents, reflective of transfers from Homeless Solutions and Equitable Communities to support ongoing prevention efforts and align programmatic operations. While our budget is proposed to increase, Child and Family Wellbeing was not able to move forward with all of its desired expansions of service delivery and is reducing some technical assistance contracts that do not provide direct services to families. Aside from transferring 2 positions from HSEC, no new positions are being added, even though we are adding responsibilities for increased family finding to support placements with relatives and implementing the Children's Crisis Continuum pilot. To note, the First 5 Commission is a separate legal entity and has a separate budget from the county, approved annually by the commissioners. The operating budget for First 5 for fiscal year 23-24 is $35.9 million and is projected to decrease by $1.1 million for a $34.8 million allocation in fiscal year 24-25 due to the operational reduction of 2 FTEs through attrition and a few pilot programs that will be ending in June 2024. The Commission approved the operating budget for First 5 for fiscal year 24-25 on April 18th, 2024. This is a deeper look at the net increase of $22.2 million, which is comprised of the following significant budget adjustments. An increase of $22.7 million due to negotiated labor agreements and a reduction in assumed vacancies due to implementation of targeted recruitment strategies. As mentioned previously, based on the budget equity assessment, additional investments are being made in transitional housing programs and prevention funding. We also have a decrease of $1.7 million associated with operational savings tied to restructuring training and administrative support, transitioning desks phones to Teams phones, aligning operations to spending trends, and reducing spending on contracts that do not provide direct services. As we built our budget and operational plan, we actively sought ways to address funding gaps that maintain our core operations and state-mandated services. We started by reducing spending on contracts as mentioned, shifting much of the work in-house without adding positions. By restructuring training and administrative support, we have been able to decrease the budget by $1.7 million. We continue to improve efficiencies to further decrease expenditures, such as with the creation of the electronic reporting option for mandated reporters. We will focus on prevention and addressing the needs of families before foster care is a necessary intervention. We have started to prepare local contractors to take advantage of the Family First Prevention Services Act to maximize our use of federal revenue for additional evidence-based services for families to help children remain safely in their home. We're using one-time realignment funding as a bridge for increases in salaries and benefits, aligning caseload levels, and continuing the transition from the Title IV waiver. This next year will bring new challenges and opportunities. All of our staff at Child and Family Wellbeing remain committed to ensuring every child grows up safe, nurtured, and ready to learn. I would like to thank our entire team at Child and Family Wellbeing for a successful first year of the transformation of the new department. Thank you. And now I would like to turn it over to Rick Wani, Director for Self-Sufficiency Services.
Thank you, Kim. Now like to present to you a departmental overview of self-sufficiency services. Self-sufficiency services provides eligibility determination for state, federal, and local public assistance programs to over 1 million residents to help families, older adults, veterans, and their children meet basic needs. We ensure compliance with federal and state and federal requirements by providing outcome-based, accurate, and accessible data, program guidance, and enrollment information for frontline staff. Self-sufficiency services solicits engagement from the community through different venues such as outreach events and advisory boards. Through an equity lens, self-sufficiency services administers mandated federal and state entitlement assistance programs, including Medi-Cal for health insurance, CalFresh for food assistance, CalWorks for cash assistance for families, General Relief for cash assistance for indigent adults, and County Veteran Services for benefits, counseling, and other state benefits. Self-sufficiency services accomplishments for the current year include: we've provided services for more than 1.3 million children, families, adults, and older adults, and veterans. We distributed $1.1 billion in cash and food assistance benefits. In the last 12 months, we have experienced our highest enrollment in county history for Medi-Cal with over 1.1 million recipients, and for CalFresh with over 563,000 recipients, while we maintain timely application processing, increasing access, and timely delivery of programs while reducing barriers. We increased to 94,000 the number of older adults on CalFresh from 87,000. We increased by 210,000 the number of semi-annual eligibility reports submitted through our customer self-service website. We received more than 3.1 million access call center calls with an average wait time of less than 4 minutes. We imaged more than 4.3 million documents for our customers' virtual paperless case files. Additional accomplishments include, in partnership with Homeless Solutions and Equitable Communities, Housing and Community Development Services, Behavioral Health Services, Public Health Services, and Aging and Dependent Services, and other HSA departments, we deployed the Live Well mobile offices to more than 450 outreach and enrollment events, serving more than 45,000 residents. We received nearly 600,000 in-person visits at our family resource centers. We successfully implemented, from your board's direction, the $4,000 one-time cash assistance program, Recovery Action for Tomorrow, or RAFT, to 2,250 households throughout San Diego County. And we approved 12,800 disaster CalFresh applications, amounting to more than $5.7 million in benefits to flood victims in San Diego County. Looking ahead, we are anticipating continued historic numbers of new program applications and caseload growth. We are anticipating significant state and federal administrative funding reductions for self-sufficiency programs, and we will face challenges of maintaining state and federal program service delivery metrics. These charts demonstrate the significant increase in enrollment and caseload growth since 2012. For our Medi-Cal program, 177% increase. For General Relief, 291% increase. And not shown on the chart here, for CalFresh, a 60% increase. Now I will share how self-sufficiency services aligns to the county strategic plan. Some examples include, for sustainability, as part of reducing and eliminating poverty and promoting economic sustainability for all, we will support legislative policies to enhance services that allow residents to transition to self-sufficiency, and we will actively combat climate change by continuing carbon footprint reduction sustainability efforts, such as remote work, and reviewing office space for opportunities to share, consolidate, or eliminate spaces. For equity, We will address disparities and advance economic opportunities by increasing the number of older adults receiving CalFresh benefits through outreach and partnerships with aging and independent services and community-based organizations to remove barriers and expand economic opportunities. We will continue to process benefit applications timely to fully optimize access to health and social services. We will provide veteran benefits counseling and referral services. For Empower, we will invest in our workforce and operations by providing support services and excellent customer service through promoting alternative pathways to access, to provide information electronically, and through customer self-service. And we will utilize information from our employee surveys, and we will continue collaboration with our employee representative groups. As part of budget equity, Self-Sufficiency Services provides public assistance and outreach that prioritizes underserved groups, including low-income, immigrants, refugees, rural, Black, Indigenous people of color, LGBTQI+, IA+, persons with disabilities, and unhoused people. And we connect customers to benefits directly in communities by using the Live Well mobile offices and through partnerships with community-based organizations. This slide presents a summary of the Self-Sufficiency Services expenditures for the next fiscal year. Planning for the fiscal year 24-25 budget began with the utilization of the budget equity tool. The 24-25 recommended budget is over $812 million. Our budget is proposed to go up by $26 million, largely tied to increases in salary and benefits shown in the regional self-sufficiencies row, where the majority of our positions reside. Self-Sufficiency Services has the highest number of budgeted staff in HHSA at 2,846 full-time employees, driven by human service specialists responsible for enrolling residents in essential safety net services. Given the state's budget shortfall, positions are essentially flat in the budget year, with some transfers among departments in the agency resulting in a net increase of 1 position. However, last year, over 100 positions were added to help address our increasing caseloads and demands for safety net services, and we have filled all those positions, maintaining essentially 0 vacancies over the last several months. We are currently meeting or exceeding state performance requirements around service delivery, and we will continue to monitor performance closely. Self-Sufficiency Services' significant budget adjustments shown here are tied to negotiated labor agreements and adjustments to remove vacancy savings. There is also an increase of almost $15 million for increased public assistance benefit costs, driven by increases in the General Relief Program. The General Relief Program provides cash assistance for indigent adults who have no other means of support and is entirely funded with county general purpose revenue. We have a decrease of $12.6 million, which includes almost $10 million projected across various CalWORks supportive services programs. In aligning with current year funding, $10 million less is projected to be available for programming supporting the CalWORks Housing Support Program, employment services, intensive case management services, family stabilization services. And during the past few fiscal years, the CalWORks Housing Support Program, employment services, and intensive case management programs were able to greatly expand services and supports to our customers due to significant increases in state funding. Services would be scaled back to align with the current reduction in state funding and available resources. Amounts proposed do not reflect any additional adjustments that may be necessary depending on the outcome of the state budget proposals. In addition, part of the $12.6 million net decrease includes $2.8 million in the CalFresh employment and training program to align with caseload trends. And lastly, there is an increase of $9.6 million to align the budget with various costs of doing business, including rents, leases, security guard costs, and utilities. In closing, based upon the information received last week from the governor's May revise, Self-sufficiency services budget mitigation strategies for next fiscal year will include focusing on core services, aligning service levels with state performance requirements as we are currently exceeding them, suspending new position requests, absorbing significant caseload growth. We will use one-time bridge funding of realignment, and we will employ revenue strategies by maximizing administrative allocations, and we will continue our efforts with state legislative advocacy to provide the needed resources for our programs. I will now turn the presentation over to David Estrella, Director for Housing and Community Development Services.
Thanks, Rick. Good morning. Housing and Community Development Services provide safe and affordable housing opportunities to low-income households while also improving neighborhoods through community development opportunities and management of innovative housing initiatives. Our mission is to support low-income families in achieving stable housing in San Diego County. In addition, HCDS also serves as the county's housing authority, which administers housing assistance programs, such as the Section 8 program, and serves approximately 12,000 low-income households in the region each month. Core programs for HCDS include affordable housing development, which provides funding to developers for the creation and preservation of affordable housing for low-income residents throughout the region, and community development, which provides funding for infrastructure facilities and services that enhance communities and create sustainable living environments. The County Housing Authority serves the unincorporated areas and 13 of the 18 incorporated cities. We administer rental assistance programs that give low-income families and vulnerable populations the ability to afford rent in a home that meets their needs. And finally, we operate public housing developments that provide safe and stable homes for eligible low-income families. The county's successful affordable housing efforts resulted in the completion of 8 separate developments in 8 communities in fiscal year 23-24, creating over 620 affordable units that will be home to over 1,300 people. Additionally, the county continues to leverage county-owned sites for the creation of affordable housing, with 2 sites awarded in fiscal year 23-24. Since 2017, HCDS has awarded $305 million, which includes $98 million in innovative housing trust funds and $207 million in other state, federal, and local funds to affordable housing developments for the creation of more than 5,400 affordable units throughout the region. 490 of these units are permanent supportive housing for our most vulnerable residents. This time frame is important because it coincides with the creation of the Innovative Housing Trust Fund, as well as merging of HCDS as an HHSA department. In addition to affordable housing, we're improving communities through programs such as the Tenant Legal Services Program, a regional program that provided eviction-related legal services to over 1,800 low-income individuals and families this past fiscal year. More than 300 households received permanent housing assistance through the Housing Opportunities for People with HIV/AIDS program. Over 12,000 low-income households received rental assistance through programs such as the Section 8 Housing Choice Voucher Program, the Veterans Affairs Supportive Housing Program, emergency housing vouchers, and mainstream vouchers for non-elderly disabled households. This fiscal year, over 480 new families were added to rental assistance programs. These programs contribute over $17 million each month into the local economy through payments to landlords. In addition, the County Housing Authority also owns and operates 121 affordable apartments at 4 public housing sites in Chula Vista and 38 affordable units in San Marcos for low-income agricultural workers. Looking ahead to next fiscal year, HCDS will continue to support the county's framework for ending homelessness and county's upcoming housing blueprint. We will continue to increase affordable housing opportunities and leverage partnerships with over 1,200 affordable units currently under construction and another 2,000 affordable units that are in the pipeline. We're also working with philanthropic groups such as the San Diego Foundation to ensure valuable resources are secured for the San Diego region. We will implement new programs such as the Shared Housing for Older Adults program to reduce housing insecurity for low-income seniors. In addition, HCDS will financially reposition the public housing portfolio to maximize federal funding and better position the county to address future improvements to the sites as they age. Lastly, HCDS will implement major process changes in the Housing Choice Voucher and public housing programs that will lead to administrative efficiencies that streamline the application and recertification processes for our customers. These changes will align with the updates to federal regulations. HCDS programs and efforts align and support the county's strategic plan initiatives. For sustainability, HCDS, in partnership with the Department of General Services, will leverage county-owned excess properties to develop affordable housing, which supports the board's initiative and support regional efforts to create 10,000 affordable housing units on publicly owned land. This effort includes collaborations with other public agencies such as transit, schools and universities, and local municipalities throughout our region. We also give preference to developments that utilize sustainable development practices. In supporting equity in the community, HCDS will provide rental assistance to 800 veterans experiencing homelessness through the Veterans Affairs Supportive Housing, or VASH, program. To empower our team, HCDS conducts diversity, equity, and inclusion trainings and discussion forums for our staff. This investment in our workforce creates a diverse and inclusive working environment. HCDS will engage landlords in the county's housing authority jurisdiction, which includes the unincorporated communities and 13 of the 18 cities. This will increase housing opportunities for low-income residents, including individuals experiencing homelessness and other vulnerable populations, ultimately increasing the well-being of our community. And lastly, HCDS supports just and equitable housing opportunities by providing tenant legal services to reduce disparities and ensure equitable access to legal representation for all. In order to advance equity, the programs and services in our proposed HCDS budget serve the households that are most in need and historically underserved communities. Low-income households with incomes at or below 80% of the area median income struggle to make ends meet, especially in San Diego County, where housing expenses, including rent and mortgage payments, have seen dramatic increases in the last several years. More than half of our households in our region pay over 30% of their income towards housing, while our lowest income renters spend over 60% of their income on rent, leaving very little for meals, transportation, medical care, and other necessities. The affordable housing developments that we finance create dedicated units for low-income populations where rents will remain affordable for decades. Even as our rents continue to rise, our rental assistance programs provide financial stability for participants in our programs so that they are not overly burdened by housing expenses. The support that rental assistance provides also empowers them to choose housing that meets their needs and their unique household requirements. Additionally, the HCDS budget includes funding for fair housing efforts to promote equity for historically disadvantaged communities, secret shopper testing at residential apartments, and education and outreach to landlords helps prevent and address systemic discrimination based on race, ethnicity, age, and other protected classes. HCDS's fiscal year 2024-25 recommended budget is $90.9 million, which includes 158 positions. Our department continues to make new investments to ensure critical affordable housing, community development, and rental assistance programs are available in the community. The overall decrease of $8.5 million reflects the completion of prior year one-time funding. Of particular importance, the county's housing authority is a separate legal entity and has a separate budget from the county. The total budget for the County Housing Authority for fiscal year 23-24 is $239 million, of which $202 is for the Section 8 Housing Choice Voucher Program. The recommended Housing Authority budget for fiscal year 24-25 will be presented to the board in June of this year. Here are our significant budget adjustments, which reflect our new investments as referenced on the last slide. Starting at the top of the table, we're proposing increases to salary and benefits due to negotiated labor agreements and assumed vacancies for existing positions, and funding for 2 additional positions that will support our Housing Choice Voucher program. We will be increasing our budget for additional temporary staffing that will assist in our transition to a new case management system for rental assistance programs, which will enhance service delivery and add customer-oriented functionality. We will also be increasing the budget by $2.4 million to implement the Pro-Housing Incentive Pilot Program, having successfully secured the funds from the state of California. This will support the county's efforts to increase affordable housing opportunities for low-income households in the unincorporated areas of the county. In addition, we're continuing to invest in our Innovative Housing Trust Fund through the new infusion of $10.6 million from the Evergreen component of ARPA framework, as approved by the board on February 27, 2024. Lastly, we're reducing appropriations to remove the prior year one-time funding allocated for the IHTF for housing projects awarded in fiscal year 23-24. In developing our budget, we prioritize delivery of core services and ongoing program operations. As resources are less available, areas that are not mandated but support board initiatives will be difficult to maintain at previous levels. For example, HCDS plays a major role in supporting the county's Leave No Veteran Homeless initiative. So far, this fiscal year, 195 veterans experiencing homelessness were housed through the county's VASH program, and almost all of those veterans have benefited from some component of the county-funded landlord incentive program. To meet the increasing demand for the program this fiscal year, we were able to identify one-time federal funding to increase capacity. Moving forward, if the demand continues to increase without new and sustainable resources, this benefit will return to the previous service levels, which will be limited, and funding will be prioritized to address immediate needs. HCDS's budget also includes tenant legal services to support households facing eviction. The county leveraged one-time ARPA funding to expand this service over the past 3 fiscal years. Again, to meet increased demand in the region. If ongoing funds are not identified, we will begin to reduce the level of service starting in fiscal year 25-26. Another area to highlight is affordable housing. This year's budget proposal includes $10.6 million for the Innovative Housing Trust Fund, or IHTF. Since 2017, the board has provided several infusions of funding into the IHTF, creating a pipeline of affordable housing developments. But without continued dedicated funding source, the county will struggle to maintain the affordable housing production in future years. While the upcoming housing blueprint, any proposed new and expanded housing-related initiatives will require funding beyond what is included in the current proposed budget to implement. I'll now turn the presentation over to Barbara Jimenez, Community Operations Officer for Homeless Solutions and Equitable Communities. Thank you.
Thank you, David. The Department of Homeless Solutions and Equitable Communities, or HSEC, provides resources and support to address the needs of traditionally under-resourced and vulnerable groups, immigrant and refugee communities, and people at risk of or experiencing homelessness. We achieve this through the staff in our department's 3 offices: the Office of Homeless Solutions, the Office of Equitable Communities, and the Office of Immigrant and Refugee Affairs. The Office of Homeless Solutions is focused on countywide coordination and collaboration across the homelessness continuum of care. The office is comprised of 2 branches. The Direct Services branch are our boots-on-the-ground staff that lead outreach in the vast unincorporated county and partners across all city jurisdictions to assist those who are at risk of or experiencing homelessness. The Program and Development and Strategic Planning branch is responsible for programming, securing funding grants, and strategic planning under the county's framework for ending homelessness. The Office of Equitable Communities facilitates monthly community leadership team meetings across our 6 HHSA regions to foster and cultivate community partnerships, utilize dynamic team of community health workers providing education, system navigation, and connections to important resources throughout the county. In addition, the Community Action Partnership Team supports services that focuses on priorities identified by the community through our yearly community needs assessment, including programs that reduce economic disparities. The Office of Immigrant and Refugee Affairs serves as a centralized resource hub through the county welcome centers and facilitates access to resources, services, and hosts various community partners. On the heels of a successful year with our National City Welcome Center, a soft opening for our second Welcome Center in North County to help empower economic mobility and meet the unique needs of the communities is underway. A key focus of this office is engaging and convening with stakeholders through community listening sessions throughout the county. This office also leverages federal and state funding to provide employment and supportive services to refugees and newly arrived immigrants in the region. HSEC also continues to administer and provide critical services through the pilot shallow rental subsidy program, which was expanded to provide 380 senior households with a $500 monthly rental subsidy and case management services. The Housing Disabilities Advocacy Program, which has served over 300 people with housing supports and advocacy for disability benefits. The Home Safe Program, in partnership with Aging and Independent Services, has served 100 older adults with temporary housing and support to enter permanent housing solutions. And additionally, the Homeless Solution and Prevention Action Plan was completed, and we continue to advance the action plan measurable objectives and action steps, which were developed to track counties' collective impact on ending homelessness in alignment with the framework. In alignment with our county's framework for ending homelessness, HSEC ensures all efforts support forward, collaborative, and impactful progress through ongoing direct outreach services and programs for people at risk of or experiencing homelessness. This past year, the Homeless Services team made 50,000 duplicated engagements with people at risk of or experiencing homelessness across the county through street outreach and direct connections to services within the community. As part of these duplicated outreach engagement efforts, our teams made connection with people experiencing homelessness to build rapport and trust, and in doing so, made over 7,000 connections to essential public assistance benefits during outreach in the fields, on the streets, and in encampments. And we're also able to connect over 1,500 people who were experiencing homelessness to housing. The county was also awarded $22 million to serve people experiencing homelessness who were living in encampments within the San Diego Riverbed and the Plaza Bonita areas. Efforts are in partnership with local jurisdictions and entities such as the cities of San Diego, Santee, Chula Vista, National City, and Caltrans, and will include coordinated outreach efforts, emergency housing to stabilize individuals, and wraparound services to move individuals from emergency to permanent housing solutions. Both projects have been implemented. The team is engaged in outreach efforts and have begun sheltering individuals in the program. HSEC continues to place efforts on providing compassionate emergency solutions and pathways to housing. By 2025, HSEC anticipates bringing 150 new emergency shelter beds and 60 safe parking spaces, with current projects focused on 2 new safe parking locations, including an RV safe parking site for older adults and families and a sleeping cabin site, all within the county's unincorporated areas. HSEC efforts towards supporting under-resourced individuals and families to thrive include providing over 16,000 community members with stabilization services such as childcare, food kits, sheltering, free tax preparation services, job training, and more, and connecting with over 280 individuals at the Southeastern Livable Center Information and Hiring Fair and County Job Fair events, and providing opportunities to apply for positions in multiple departments and at varying levels. Several same-day interviews took place, and some individuals were even hired on the spot. Our outreach and engagement efforts included conducting in-person community outreach and engagement and providing education to over 60,000 individuals, sending weekly newsletters to over 3,500 people related to health, emergency preparedness, and basic needs resources, distributing over 12,000 resource materials to connect households to the recently ended Affordable Connectivity Program, which ensured lower-income households can afford the broadband they need for work, school, healthcare, and more. implementing the third year of the Community Health Worker Trainer Program with 150 graduates who are now more equipped to provide culturally responsive public health information, outreach, and service referrals throughout the entire region. Engaging over 1,200 grandparents and kinship caregivers and their families through the Grandparents Raising Grandchildren initiative by hosting educational symposium, family enrichment activities, providing access to financial and legal resources, offering respite to caregivers, and fostering connections among families. HSEC partners closely with Aging and Independence Services, Child, Family, and Wellbeing, Medical Care Services, and Parks and Recreation to carry out these activities. Related to this initiative, HSEC was selected as one of 2 jurisdictions nationwide to receive an award from the Bridging Systems for Kinship Families Project. This award will focus on strategic planning and leveraging capacity among partners and residents to improve services and access to resources for kinship families throughout the county. In support of immigrant and refugee affairs populations, HSEC secured over $4.5 million in funding to support those displaced due to the war in Ukraine with obtaining housing, utility assistance, and other support services. Provided resources to over 2,800 people at the county's National City Welcome Center, and provided support for refugees in San Diego County by training and educating over 130 housing industry professionals about the benefits of renting to refugees from Afghanistan and other communities. In the coming year, HSEC will continue efforts on expanding compassionate emergency solutions and pathway to housing to increase our shelter capacity within the region, which will include a temporary safe parking site in the Grantville area until construction of a scheduled affordable housing project begins. We will release public dashboards to highlight the work being done to achieve our goals within the Homelessness Solutions and Prevention Action Plan. We'll continue to engage with the community to seek their input as part of the 2024 Community Needs Assessment, which will inform the priorities within the 2026-2027 Community Action Plan, and will continue to partner with the Grand Families and Kinship Support Network for the Bridging Systems for Kinship Families project. In addition, we will utilize funds to establish programs providing English language training, support with employment services, and other support to assist individuals and families displaced from the war in Ukraine to achieve self-sufficiency. We'll strengthen partnerships with community-based organizations and contract providers to better coordinate services for the immigrant and refugee community. And lastly, establish the Migrant Transition Day Center, which will provide non-migrant citizens with food, hygiene products, translation services, short-term shelter for those awaiting onward travel, and support with securing transportation to their destination. Efforts related to standing up the temporary safe parking site in Grantville and the Migrant Transition Day Center will be included in the fiscal year 24-26 CAO recommended operational plan change letter. Our departmental operations under the Health and Human Services Agency are aligned with the county's strategic plan and contribute to the overall success of the region. We aim to achieve sustainability by helping communities thrive now and into the future, by engaging individuals, by connecting them to resources and services through the county's welcome centers, and expanding economic enhancement opportunities by assessing and connecting people to stabilization resources and services, including housing, transportation, childcare, food, clothing, hygiene kits, and utility payments. True to the name of our department, we promote equity by working with the hardest to reach and most vulnerable populations to ensure all residents have access to services. And we do this by engaging with residents countywide to provide outreach and education on health and social services, and providing low-income rent-burdened older adults with rental subsidies to support housing stability through the Pilot Shallow Rental Subsidy Program. In the work we do, we continue to empower our department through continuous self-evaluation and improvement by dedicating efforts to enhancing two-way communication of information between our leadership and line staff, and establishing a baseline score for the HEART Customer Service Survey within HSEC. We continue to focus on strengthening our communities and creating opportunities for San Diegans to grow, connect, and thrive by co-leading the 5 regional community leadership teams alongside community co-chairs within the 6 HHSA service regions in San Diego County, and providing outreach and case management to individuals who are at risk of or experiencing homelessness. Our department continues to align our various programs and services to the county's strategic plan to ensure all San Diegans are healthy, safe, and thriving. As we carry out our services and programming, it is vital that we acknowledge that significant health and economic disparities among communities. These disparities are driven in part by a history of inequities within our systems, barriers to information, and access to resources. To breach these gaps and center our approach on equity, HSEC utilizes various tools such as listening sessions, collaborative meetings, and public hearings to engage with the community to ensure stakeholder feedback is incorporated into programming and services. Examples of this include our participation in co-leading several community collaborative meetings on homelessness, such as co-leading the regional homeless outreach meetings alongside the Regional Task Force on Homelessness, participating in the sub-regional homelessness planning groups, and serving as a member of the Continuum of Care Committee, led by the Regional Task Force on Homelessness. Our regional community coordinators facilitate ongoing community regional leadership team meetings, which are comprised of diverse partners and agencies who work together to advance a shared vision of a region that is healthy, safe, and thriving. Meetings provide a space for networking, identifying regional priorities, sharing tools and resources, and facilitating collaborative action. Projects and priority action items are community-driven and centered on improving equity for all. And through various community listening sessions and convenings, HSIC gathers input to highlight the continued need for funds to support programs and services designed to advance equity for the newly arriving and current refugees and migrants. This slide shows a summary of our expenditures, and our department is proposing a budget of $98.7 million for the upcoming year, including $16.7 million in new investments and 160 positions, which I will discuss in the next slide. HSEC will have an increase of $6.9 million in salaries and benefits tied to negotiated labor agreements and temporary staffing associated with time-limited grants and project funding. The decrease in 2 staff years shown on the slide is due to the transfer of staff from the Office of Equitable Communities to Child and Family Wellbeing to support their operational needs. There's an increase of $7.8 million in encampment resolution funding, which will be used to close encampments and move people experiencing homelessness within the San Diego Riverbed and Plaza Bonita encampment grants into housing and shelter. There's a budget adjustment of $5.6 million for the Regional Homeless Assistance Program to align to a total one-time budget of $15 million funded through ARPA to support people experiencing homelessness within the County of San Diego's unincorporated areas with emergency housing. There's an increase of $2.8 million for the local rent subsidy program, which provides rental assistance for persons transitioning out of the emergency housing programs. There's an increase of $500,000 for the inclement weather program, which provides temporary shelter services and is funded through ARPA. There's a net increase of $4.3 million in new federal funding called the Additional Ukraine Supplemental Appropriations Act to provide resettlement and housing assistance and other services to individuals that were displaced due to the war in Ukraine. And lastly, HSEC anticipates receiving a little over $19.5 million in funding from the Federal Emergency Management Agency through the fiscal year 2024 Shelter and Services Program to establish the Migrant Transition Day Center. As federal and state funding supplements our budget, it is not always enough to fully fund all areas. We're seeing a great need for our services throughout the county. We'll need to identify funding to assist in continuing some of our programs that have received one-time funding allocations, such as the Regional Homeless Assistance Program, the Local Rental Subsidy Program, and the Inclement Weather Program. As a result of a tough fiscal climate, we will continue to prioritize services based on intentional community and stakeholder engagement. This concludes my portion of the presentation. I'll now turn it over to Dr. Luke Bergman.
Thank you, Barbara, and good morning, Beverly. Behavioral Health Services provides mental health and substance use services to over 100,000 people of all ages in San Diego County annually through our network of care. We work across 4 distinct domains. By statute and federal waiver, we are the specialty plan or managed care plan for Medi-Cal beneficiaries with serious mental illness and substance use disorders. A key characteristic of this group is that those within it are in states of relative crisis or needing care that's particularly intensive. To support the behavioral health care of this population, we maintain a coordinated system of care through a network of 350 contracted programs and 300 fee-for-service providers. We also provide direct services at the San Diego County Psych Hospital, Edgemore Skilled Nursing Facility, and through the county-operated clinics and case management services across the region. Finally, we act as a public health entity, taking a population health approach to improving the behavioral health of everyone in San Diego County. As a department, Behavioral Health Services remains committed to achieving a healthy, safe, and thriving region by providing accessible, culturally aware, community-based services throughout the region to support the wellness of children, adults, and families. Our prevention programs engage and connect people to care to prevent escalation of symptoms. Community outreach and engagement services work to educate the community about services, how to talk with loved ones who may need care, and risks associated with substance use. Our treatment services range from mental health and substance use outpatient and residential treatment services to crisis services and inpatient care. I wanted to highlight the artwork on this slide that was created by clients receiving care from the county's strengths-based case management program. Our long-term care services, inclusive of subacute and community-based care, support people over time to keep them stable. We also fund an array of transitional and permanent supportive housing for people with behavioral health conditions while they're connecting to care or engaged in treatment. Behavioral Health Services also oversees the Public Conservator's Office, which arranges placement and mental health treatment for adults who are gravely disabled due to a mental health condition and are incapable of accepting voluntary treatment and whose family are not able and willing to meet their personal needs. We continued our focus on prevention, crisis, and diversionary services, inpatient and residential care, and long-term care, making strategic investments and forging partnerships to help people stay connected to care. In terms of dedicated infrastructure, construction of the Tri-City Psychiatric Health Facility has progressed, as seen in the photo on this slide. The 16-bed facility is anticipated to be completed in early fiscal year 24-25, with services commencing shortly after. We proceeded with planning for the new Crisis Stabilization Unit facility in the East Region, along with new psychiatric acute inpatient unit within our Edgemore facility. We're also planning the Central Region Community-Based Care Facility in Hillcrest, which will establish dedicated board and care capacity for people with serious mental illness. We made progress toward recommendations from the Behavioral Health Optimal Care Pathways, or OCP model, by establishing 55 new board and care slots that gets us closer to the nearly 400 beds that we need. We advanced efforts to redesign the San Diego County Psych Hospital, shifting beds primarily toward long-term care. Our department also expanded mobile crisis response teams to a total of 44 MCRTs, responding countywide to people experiencing a mental health crisis. This fiscal year, MCRTs responded to 3,365 calls so far, which is an increase over the previous year. Last fiscal year, our specialty care system had nearly 133,000 adult outpatient encounters and over 173,000 children and youth outpatient encounters. People utilized over 81,500 inpatient bed days across the adult system and about 5,400 children and youth inpatient days. Additionally, in the same fiscal year, we had over 24,300 substance use disorder encounters. We implemented activities outlined in the opioid settlement framework, including issuing a procurement for the San Diego ED Relay program, which is anticipated to begin early in the next fiscal year. And for public health messaging efforts, our illicit fentanyl awareness campaign had a reach of nearly 300 million impressions, views, representing the number of times our content was displayed on various platforms tailored to youth, teens, transition-age youth, and their parents. Additionally, we distributed an estimated 7,000 naloxone kits via the County of San Diego naloxone distribution program and placed 4 additional naloxone vending machines at Las Colinas, George Bailey, Vista, and East Mesa detention facilities. The Screening to Care program provided mental health screenings to nearly 15,000 middle school students countywide through March. Finally, we pursued grant funding of over $36 million and have been awarded nearly $9 million for mobile crisis response teams and youth suicide prevention. Our department advanced work for new programs and statewide initiatives. In October, we implemented the CARE Act program, requiring intensive collaboration with community partners to create a new pathway to care for people diagnosed with schizophrenia or other psychotic disorders who are not engaged in treatment. We also hired a new team of talented county employees, many of whom are seen in the picture on this slide. To date, San Diego County has had considerably higher CARE Act program volume than any other county, with the CARE Act team receiving nearly 109 petitions, resulting in 34 CARE agreements as of the end of April. We accelerated planning for the Senate Bill 43, or involuntary behavioral health treatment, by convening a collaborative work group to inform readiness activities in support of the January 1st, 2025 start date. We also began transforming the way we pay for care under behavioral health payment reform. Last July, we began transitioning nearly 200 contracted and county-operated Medi-Cal service providers from a cost reimbursement to a fee-for-service payment structure, fundamentally overhauling the way services are reimbursed. Shifting to a fee-for-service payment enables the delivery of value-based care that improves quality of life and health outcomes of Medi-Cal beneficiaries while reducing administrative burden for the entire system. Going forward, new state mandates are anticipated to significantly impact our system of care. For the CARE Act program, we'll continue to evaluate needs to ensure adequate service and housing capacity are available. For SB 43, we're anticipating significant additional legislative and regulatory changes so we can access Medi-Cal reimbursement. Currently, no new state funding is available for this program, and the regulations don't support the clinical work that's mandated. Our department is implementing behavioral health payment reform, and we're optimistic about new opportunities to draw down additional federal revenue in support of the workforce and care incentives. We're partnering with the Public Safety Group to address increased referrals for evaluations for incompetence to stand trial. And finally, with the passage of Proposition 1, we anticipate significant impacts and opportunities for our system under the Behavioral Health Services Act. Proposition 1 also presents us with potential new funding for critical capital projects through the $6.3 billion behavioral health infrastructure bond. Though it feels a bit overwhelming, we remain excited for these new opportunities, and I'm grateful for our dedicated staff charged with implementing these many changes. Behavioral health services is well aligned with the county's strategic plan. Our sustainability goals include encouraging contractors to evaluate the use of electric vehicles and partnering with the Department of General Services in the sustainable construction of new facilities. We're prioritizing equity through a regionally distributed services to reduce health disparities and ensure care is accessible and tailored to our diverse communities. And most critical is our strong commitment to investing in a workforce that reflects our community. We are refining employee engagement to ensure the needs of our employees are being met. Based on direct feedback from the 2022 Countywide Employee Engagement Survey, we're concentrating efforts on improving communication and facilitating opportunities for staff to connect with leadership through focus groups and fireside chats. Within Edgemore, we added key nursing positions to support more optimal operations, and all levels of staff were included on the committees to support the development of work policies and procedures. To support the community strategy, we work towards meaningful engagement with community stakeholders within established venues such as our Behavioral Health Advisory Board, councils, and contractor associations, and through the Community Experience Partnership. We also enhance responsive public messaging efforts through focused health promotion messaging tailored to specific populations, such as the Youth Suicide Crisis Response and Reporting Pilot. Lastly, in collaboration with public safety partners, we'll work to enhance services for people with justice involvement, including planning for the new state-mandated behavioral health linkage program designed to provide community-based treatment for youth released from detention facilities. Behavioral health services serves people of all ages from diverse and underserved communities, including people experiencing homelessness, those who identify as LGBTQIA+, BIPOC communities, children and adults with justice involvement, and people with complex behavioral health needs. To advance equity, we use an array of strategies tailored to meet community needs. We take a population health approach to drive the design, placement, and implementation of services. The Community Experience Partnership, or CEP, integrates data and community feedback to support planning and program development and address unmet behavioral health needs. Through the Community Program Planning Process, or CPP, Behavioral Health Services conducts community-based workshops to identify and develop tailored, data-driven programs for racial and ethnic groups and groups of shared identity. We've also integrated community health workers into our outreach and education efforts. Examples that highlight equity within this recommended budget include establishing new board and care beds, increases for substance use services, and the new Tri-City Psychiatric Health Facility in North County. This slide shows a summary of our general fund expenditures. Our department is proposing new investments totaling $135.6 million for a total budget of nearly $1.16 billion. We're proposing new investments to ensure people of all ages have better access to the services they need. Within prevention, we're adding $6.8 million to prevent adverse childhood experiences, or ACEs, to support Native American prevention and early intervention program, and the Youth Suicide Prevention Pilot for response and reporting to suicides or suicide attempts among people under 25. For substance use services, we will increase the budget by $29.4 million for residential and outpatient treatment services, primarily due to rate enhancements under payment reform, and for opioid settlement framework initiatives, including overdose prevention, emergency department, relay, and the ED drug checking program. We're also increasing the budget by $35.8 million through a partnership with the Viejas Band of Kumeyaay Indians for a new opioid treatment program in the East region. The board approved $15 million of one-time bridge funding from the ARPA Evergreen Fund for implementation of SB 43 to expand services, infrastructure, and training in hospital and community-based settings. Within mental health services, we will invest $6 million for long-term care to include subacute care and new board and care capacity through the use of behavioral health bridge housing grant funds. We'll increase the budget by $10.6 million for the new Tri-City Psychiatric Health Facility, which comes online next fiscal year, and for acute inpatient bed rate increases. We'll also add $1.7 million for outpatient treatment, youth and family support services at home key housing sites, and for children's outpatient services, including intensive outpatient, partial hospitalization, and the schooling program. Also included is a reduction in appropriations for several mental health programs to align with actual spending, which isn't anticipated to impact service delivery. Lastly, Behavioral Health Services remains committed to investing in our most important resource, the workforce. We're proposing to add $15 million for the new Mental Health Services Act, or MHSA, innovation program, and a $10 million of ARPA Evergreen Fund to recruit and retain the public behavioral health workforce and to expand the pool of small, community-based organizations equipped to provide Medi-Cal-funded services within diverse communities. While these increases are immensely helpful, we continue to see growing need for mental health and substance use care. In light of the current financial challenges, our budget development process focused on continuity of mandated and core services while looking at strategies to address funding gaps. Our budget also prioritized strategies outlined in the Optimal Care Pathways model to connect people to the care they need in the least restrictive settings. Additionally, we've aligned the budget with spending trends, which should not impact service delivery. Our department does propose, however, delaying budget and service enhancements, if not mandated, along with new position requests within finance, data science, and direct services. We also anticipate new revenue opportunities through the implementation of behavioral health payment reform, which will draw down additional federal funding. And we're utilizing tobacco securitization funds to offset recovery residence costs and the substance use peer support program previously funded via local funds. Finally, we will use one-time realignment funds to help support salary and benefit increases and other essential ongoing services. I'll now turn it back over to Dr. McDonald.
Thank you, Dr. Bergman. On behalf of all of the agency departments, thank you for your time and your continued support for the essential services that we provide. As you heard, our departments are strongly aligned with the county's strategic initiatives. As we move through the difficult fiscal environment ahead, we will continue to balance through an equity lens our core functions and discretionary programs. I'm proud that ultimately this proposed budget focuses on prioritizing critical services for our most vulnerable populations. None of this work would be possible without the nearly 8,000 staff at the Health and Human Services Agency. I'd like to extend my sincere gratitude to each and every one of them. I also want to recognize our many community partners, advisory board members, and contractors who are critical to helping San Diego County residents live well. Much of our work depends on partnerships with other departments within the county, and we look forward to continuing to explore with our colleagues additional ways to leverage county-wide resources. Thank you again, and subject to your questions, that concludes our presentation this morning.
Thank you. On behalf of Chairwoman Vargas, she would like me to thank you for using the equity tool and prioritizing our vulnerable communities. Thank you to all of the HHSA team members and look forward to future discussions. On behalf of Chairwoman Vargas, are there any supervisors that would like to make comments on this issue? Supervisor Jesper.
Thank you, and thank you, Chair, through the clerk. Thanks for the presentation. This is overwhelming. I enjoyed all 86 slides. I ask this probably every year. These realignment funds, they seem like magical dollars. And I know that it was mentioned several times that realignment funds carried over from previous years. One-time realignment funds, can you explain it to me again, where these come from and how these are used? Thank you.
I'm going to defer that one to our financial expert. She explains it better than anyone else.
Okay. Thank you, Supervisor. So realignment funds are driven by state sales tax receipts. You'll see in Ebony's presentations that she's been giving to the board on her quarterly updates. We had a significant uptick in sales tax receipts coming out of the pandemic, which we expected to slow. The slowing has occurred more dramatically than we initially expected. So this year, the agency, as we have been presenting our quarterly projections, we have a gap of about $27 million this year that is also impacting our ability to program new spending in 24-25.
Okay, but the realignment funds you're telling me are state income debt?
It's a share of state sales tax receipts, and it's based on realignment programs that were realigned in the Health and Human Services Agency in 1991 and 2011, where state general fund dollars were replaced with a dedicated share of state sales tax receipts. So when the economy performs better, we benefit because we have more dollars coming to us that we can use to fund child welfare and behavioral health and aging and independent services and self-sufficiency. But when the economy slows, we have less revenue coming to us to keep up with costs of doing business and caseload.
So is it still state sales tax funds, or is it now state general fund?
It's state sales tax receipts that come to the county. They're allocated directly from the Department of Finance to the county before going into the state general fund budget.
Well, then I also heard that we were going to take previous years.
Yes. So
funding. So is there funding we're not using in previous years?
Because of the significant increase in realignment receipts that happened right after the pandemic, we had funding that we had available that we didn't need to bring in to cover operating costs. And as Ebony had mentioned in her CFO presentation at the beginning of this morning, we often have an amount of realignment funds that have gone unused that we use to help stabilize and to help counter any slowing of annual receipts we receive.
So do we have any going into 24-25, a source of more realignment from funds from previous years?
Yes, a source of unspent realignment from previous years. And the difference going into 24-25 is that we are budgeting the entire amount that is remaining to help bridge our essential services going into 24-25 as we continue to plan for other revenue reductions.
So we're going to be using all of those past dollars, so there's not going to be any more left, I guess, from previous years. It'll have been spent to basically brace up this year, 24-25 budget.
Yes, and to allow, realignment to start to recover over the next few years.
Okay. Well, thank you on that, and I'll probably ask you again next year. Okay, and then I just had a couple of questions, and I know this is a budget hearing, but one of the things that, and I'm not trying to pick on any department or run your department, because I know this is all about budget, but I guess for Kim with the child and family well-being, that was on page 26, or slide 26, which once again was 60 slides ago. But I noticed, and I just look for things that kind of stand out in the budget process. I don't understand or run your departments or anything like that. But I noticed on this slide is the child safety slide, I guess the number of personnel, and it's really kind of sad that child safety, we got 1,504 people working just on child safety in San Diego County, which is a lot of people, and it's too bad that we have to do that. But I noticed then on child, family, and strengthening, we only got 19 people for next year. I mean, that's like 1%. I would think more, and I'm just assuming that some of the people in child safety, the 1,504, are kind of maybe working with child, family, and strengthening, because I would think that'd be more of a preventative item as opposed to, maybe stopping some of the child safety or not having to deal with child safety issues, or that not them coming about if we're actually strengthening the family. So it's just a disparity. I'm not trying to run your office, but it just seems like it just kind of stood out at me that there's a very small amount working on hopefully the preventative ed.
Yeah, no, you're absolutely right, Supervisor. And so a couple of things that I think are important. One, the bulk of services that are provided through Child and Family Strengthening are done by our community-based contractors. And so although this is our 19 staff that primarily manage those contracts and help to support that, the actual service delivery is done by a significant number of more contracted staff out in the community. And over time, as we need fewer staff in the Office of Child Safety and continue to expand the amount of work that we're doing on the prevention side, we would expect to start to shift staff from one side to the other.
Okay, well, thank you. That's just kind of a flag that stood out at me. And then I guess for behavioral health services, Dr. Luke, I noticed and I appreciate the enhancements to your slides 83, if you want to bring it up. But it's about suicide prevention, and the amount going to, and unfortunately again we have to provide for youth suicides as well as everybody else. But I remember it was a gun study that came out that about, I think it was a huge percentage, like 70% of people that actually died from guns were suicide, and the biggest group of those that were doing that was age, I think, were seniors, 65 and older. And so I didn't see, it's great that we got youth suicide prevention, but we also got senior, I didn't see seniors in there as well.
Yeah, so what you see reflected in the budget is the inclusion of a state initiative that emphasizes reporting and crisis response, and that's through CDPH. We address suicide risk across age cohorts, across the lifespan, and we do that work through our Suicide Prevention Council, through the adult and older adult council kind of driven activities. So it's a very important body of work. It's just not highlighted as an item in this budget because of the grant.
And I wanted to say thank you very much for the continued effort at Tri-City, and thanks for the report. Appreciate it.
Thank you. Supervisor Montgomery Stepp.
Thank you very much. I did appreciate each and every one of the presentations. I have questions for the 5 departments. I'll try to be quick, but I'm going to kind of go one by one backwards. So I'll start with behavioral health services. Again, want to commend the department for the very, very challenging work that you do. It's very, very critical, always has been, but especially in the time that we're in right now. So thank you for that work. I'm also looking to, and this may not be necessarily a goal of the department just based on all of the services that the county has, but always looking for proactive services and solutions for behavioral health issues that help curb the onset and progression of mental illness and addiction. And that's very, very important right now as we see this in young people as well. So I want to ask, this came up in the conversation around our contractors who we partner with to help us provide these services. Just if I could get a general sense of how in the budget process and throughout the year, we engage with our contractors and our partners to see if they're meeting, the goals that we need to meet based on our mandates and how much we are spending during the budget process.
Sure. I mean, I would say overarchingly, and I think it is commensurate with the fact that that most of our service network is made up of community-based organizations, right? Providers out in the community. That is the county specialty behavioral health plan network. Given that, ongoing, our engagement with that group of providers who constitute that network is extremely robust. We meet with them as groups of contractors, both on the mental health side and on the substance use disorder care side, both separately and together. On a monthly cadence, we also have a work group given payment reform context right now that is devoted to working with that group of providers on managing the transition from cost reimbursement to fee-for-service, as was noted in the presentation, which is really significant for providers. It's a very different way of doing business than they had been used to. And so there are a lot of concerns driven by just what is the unknown for them still in making that transition. I would say that is a transition we have started. We are approaching that very deliberately and in a phased way. What we are seeing initially is that payment reform has been very supportive to the provider network. It's something that I think is frightening, as things that are unknown to us are frightening. As the transition is actually happening, we are seeing that the community-based organizations that constitute our network, and this is true of providers of services for adults and older adults and young people as well, that the transition by and large is one that is supportive to our network, that is increasing the bottom line health of our network.
Thank you for that. Just want to get that answer in the context of our budget decisions that we have to make. So thank you. I'm going to go to Homeless Solutions and Equitable Communities. Thanks so much again for the presentation and all the work that you are doing. Wanted to ask briefly about the within the presentation and the budget documents, the over 60,000 residents that you all are able to reach with outreach and education through the community engagement efforts that you do. And then I think, Barbara, I think you mentioned that over 7,000 of those residents are then connected to services. I wanted to see if I was understanding that correctly, and also to see if there is any kind of case management involved. You know, what is the 60,000, these 60,000 folks, you know, what capacity are we dealing with them and helping them to get to the next step?
Sure, thank you for that question. So it's outreach and education opportunities. So this could be a duplicate number, but it really focuses on different events that our team is at. For example, our kinship caregivers, community outreach events, leadership team meetings. We also have a number of events where the team is actually providing education series, symposiums. They could be connecting with an individual at an outreach event. They could be talking to a group, or they could just be connecting individually to someone who has some questions and sort of, you know, kind of pulling them aside and having that interaction. What are the resources they need? Who have they already connected to? Who do they need to be connected to? What is the language support that they need? Do they need translation? So all of that can encompass the engagement. So it really runs the spectrum, just depending on what the needs are of the community member, the resident, or whoever we're connecting with. This is countywide, and our teams are out there, and includes eligibility staff. It includes social workers, which includes that case management piece. It also includes a relatively new classification, which is our community health workers. The team is out there most of the time 6 days a week, if not 7 days a week.
Okay, thank you for that. So you said that the 60,000 it could be duplicate numbers, so that could be one person being counted more than one time?
It could be. So if someone is at an event and then the next week, or actually I think a better connection to that would be if we're engaging through the Office of Homeless Solutions with someone in an encampment, for example, and we're working with them and we're back the following week or the subsequent week, we could be engaging with that same individual multiple times.
Right, okay. And so as we move forward, we will get together about how to reflect that. I think it's important for us to understand what that means and, you know, who needs what type of help and what is strictly outreach and education, who goes on to get more services, you know, are they connected to other departments in the county? The information like that, I think would be important. I'm sure you have it, may be in the 600 pages, but this stood out to me, so I just wanted to ask the question.
Did you want me to respond around the 7,000 sort of connections and then the housing?
Yeah, the 7,000 as it pertains to, is that an offset of the 60,000, or that's general outreach by the department?
So that could be a couple of different things. Through our eligibility workers, so our human service specialist, they could be connecting with individuals to either check on the status of their actual case in terms of their CalWorks, their Medi-Cal. They could also be replacing an EBT card out in the field. So it just really runs the gamut of what those connections might be as it relates to our public assistance programs in particular.
Okay, thank you for that. On to housing community development services. Housing is always a big concern, and looking at, you know, the governor's May revise, I think housing, in my opinion, is taking a hit, so that's a huge concern. And then in the presentation, we saw that the non-mandated services could be taking big hits in the future, so definitely going to keep our eye out. I just wanted to just say that I think the county has made, monumental progress in this area, and I certainly don't want to see that momentum subside. So thank you for that presentation, and I don't think I have any questions for that particular department right now. Self-sufficiency services, you mentioned in your presentation that enrollment numbers continue to increase pretty rapidly, I believe. And, when we see reports about unemployment, those numbers continue to go down. Has there been any talk in the department about how we justify that, or, what that is telling us about the economy moving forward, especially as we're looking at, the state deficit and filling in the gaps for folks?
Thank you. Thank you for your question, Supervisor Montgomery Stepp. So excellent observation that our unemployment rate here in San Diego County, as well as the state, seems relatively low, and our applications for programs continues to rise substantially. So a couple of thoughts and comments on that. One is California does have the highest unemployment rate in the nation as a state. And ever since the pandemic, the unemployment rate numbers, which used to very closely model for us how many folks would come into our programs, how many people would apply, how many people would stay on. But since the pandemic, those phenomenon indicators have been disconnected to some extent. Every county in California is seeing this. And so there are various economic reasons, which could be persons no longer being counted in the unemployment rate. There's other forms of income that people have been seeking. Some people have sort of dropped out of working to some extent in some cases. So it is a new phenomenon that did not exist the prior 80 years of our programs, but it has been a phenomenon since the sort of ending of the pandemic, and we continue to watch it closely in terms of trying to plan for the increasing caseload and workload.
Okay, yes. Thank you for watching that and monitoring it, because I think it, will at least give us some insight on policy decisions that we need to make down the road. Just one last thing for your department. I just want to touch on the net decrease of $9.8 million to CalWORK's housing support program. Excuse me. I understand this is due to reductions in state and federal funding allocations. But with so many families struggling with unemployment and income insecurity and housing insecurity, a reduction in funding for this program, which includes employment services, case management, family stabilization services, is something we also need to monitor. It could be very, very problematic for our most vulnerable communities. So I'm just requesting that HHSA and county staff convene and assess how we may be able to fill those service gaps with existing resources. But thank you very much for the presentation.
Thank you.
Last, just briefly, on child and family well-being, thank you. I'm excited about this new department even before I was a supervisor, so thank you for the work that you're doing. And my staff and I did have questions about the family member placement. 35%, I believe, is where we are. And thank you for responding to us that this is really statewide average and we're, right where we need to be there. I wanted to know, previous to this department being called the Child and Family Well-being, and, it's changing kind of the vision and the way the work is done. What was that percentage prior to that change? Do we have enough data to compare at this point?
Yes, Supervisor, we do have that longitudinal data. I don't have it off the top of my head, but I'm certainly happy to provide as many years back as you would like. We have close to about 15 years of data that we can provide.
Okay, the last 3 years would be good. I just want to see the progress from when we're, changing over the philosophy. So thank you very much. And that does conclude my questions and comments. Thank you so much.
Thank you. And not seeing any additional comments from supervisors, we'll take a 5-minute recess for staff to transition for the public safety group presentations. In terms of the scheduling, the plan is to begin the public safety group presentations, to hear from the group's overview, receive department presentations from the sheriff and district attorney, and then recess for lunch. Again, public comment will be heard at the conclusion of all the presentations on Thursday. The board is in recess, a brief 5-minute recess for staff to transition. Thank you.
Good afternoon, Chairwoman Vargas and members of the board. Today, I'll briefly overview the Public Safety Group's services, accomplishments, and priorities and highlight the departments that will not be presenting to you themselves, including Animal Services, Child Support Services, Emergency Services, Medical Examiner, and County Fire. After me, you'll hear directly from the Sheriff, District Attorney, Chief Deputy Public Defender, and the Probation Chief. The Public Safety Group supports the region by ensuring a fair and equitable justice system in the investigation, defense, and prosecution of crimes, and through services for individuals impacted by crime, by housing adult offenders and youth in county facilities, and supervising and supporting clients in the community. We also determine the cause and manner of death when someone dies unexpectedly, collect financial support for children throughout the county, support emergency preparedness, response, and recovery for the health and safety of our region. In the unincorporated area, we provide fire protection, emergency medical services, and essential animal care services. With a $2.7 billion budget, the Public Safety Group has more than 8,000 dedicated public service professionals across 9 departments. Our departments proactively address crime, safeguard against disasters, deliver impactful, evidence-based, and data-driven services. Every day, we strive to foster safety and enhance the quality of life for both residents and visitors of San Diego County through community-centered services and initiatives. Thanks to the continued collaboration of our public safety team, justice partners, and the community, San Diego County continues to be one of the safest in the nation. To begin the departmental specific information, I'll start with Child Support Services. Child support staff serve more than 53,000 families throughout the region, distributing over $180 million in child support each year that benefits the financial, emotional, and physical well-being of nearly 59,000 children. Child Support has continued its focus on enhancing accessibility of their services, including partnerships with fatherhood-related organizations and through support and assistance to parents currently on probation or parole. Child Support staff support these families through their justice-involved parents and children team. In addition, with approximately 2/3 of the child support caseload receiving cash assistance at some point, the department's Bureau of Public Assistance Investigations Unit provides the state-mandated function of public assistance program oversight administered through the county. Among other duties, this unit proactively identifies and informs individuals who have been unknowingly impacted by recent electronic benefit transfer skimming activities that their benefits had been stolen so they can begin the process of recovering those lost benefits. In the coming fiscal year, Child Support will continue collaborative partnerships to improve the well-being of clients. This includes a collaboration with the San Diego County Library to award scholarships that help clients earn a high school diploma. This leads to improved employment opportunities and helps to break the cycle of intergenerational poverty. Child Support does not receive any general purpose revenue, but is primarily funded by the state. The Office of Emergency Services plays a critical role in coordinating emergency response and recovery efforts, ensuring readiness and promoting community resilience in the face of disasters. By working collaboratively with agencies, stakeholders, and the public, Emergency Services strives to protect lives, safeguard property, and build a more resilient county. Emergency Services led the county's 2024 storm response and recovery following the devastating January storms. The day of the disaster, Emergency Services staff were responsible for alert and warning of county residents. And the days after the disaster, Emergency Services staff led the recovery efforts, coordinating local, state, and federal agencies and community-based organizations to help impacted neighborhoods. As part of the recovery efforts and in collaboration with the Health and Human Services Agency, Emergency Services and county staff initiated the Emergency Temporary Lodging Program. This was historic and novel. At its peak, the program offered more than 2,600 people impacted by the January flooding with shelter, food, and mental health services. Looking forward, emergency services will continue to train new county disaster service workers to assume disaster response and recovery roles as part of the Ready Disaster Service Worker program. There are currently 1,700 county staff trained through this program to assist in the operation of local assistance centers, emergency shelters, emergency operations centers, emergency animal shelters, and to act as call center operators during and after large-scale disasters. The Office of Emergency Services will also focus on expanding and strengthening relationships with community-based organizations who are critical partners during an emergency. Each year, Animal Services provides animal-related law enforcement, sheltering, and medical services to approximately 7,000 animals from the unincorporated area, as well as pet adoption services countywide. This fiscal year, the department used grant funding and trust fund dollars to subsidize 500 spay-neuter surgeries and provide microchip licensing and vaccination services to underserved pet owners in our community. Key investments include building a new 20,000 square foot animal care shelter in Santee. Groundbreaking is anticipated this year. The new location will provide better geographic coverage for both the East and South County, where the most services are needed, and is being designed to be more efficient and provide a safer environment for staff, animals, and the public. Our existing animal shelter in Bonita was built in 1974. In addition, Animal Services was awarded a grant of $150,000, which will be used in the coming fiscal year to establish a new voucher program for approximately 2,000 no-cost spay and neuter surgeries for pet owners experiencing financial hardship. With animal shelters nationwide experiencing significant increases in animals requiring care and services, this effort will assist in preventing unplanned litters and keeping animals out of our shelters. We encourage everyone to consider pet adoption or fostering as our shelters and those around the country look for innovative ways to decrease the number of animals in our care. Our county is one of only 5 of California's 58 counties that has an independent medical examiner to conduct death investigations. The department investigated over 4,100 deaths last year, which is a cumulative increase of 24% over the last 5 years. While deaths of all manners contributed to the increase, deaths due to accidental drug overdose, particularly due to fentanyl, continue to be the main driver of the increased caseload. Over the last several years, rates of overdose deaths involving fentanyl have increased at alarming rates countywide, from 33 deaths in 2016 to 815 deaths in 2022. As part of its dual public health and public safety function, the medical examiner works closely with the Health and Human Services Agency and other partners to provide information to assist in harm reduction, especially with accidental drug deaths, which represent nearly 30% of their entire caseload. The medical examiner provides data on cause of death trends to create understanding of neighborhoods, communities, and populations who are disproportionately affected by disease or by injury. As a result of the medical examiner's increased caseload, the department developed a backlog in toxicology testing and case report completion. Last year, some of those workload impacts were addressed using funding from the board for additional toxicologist and pathologist positions to reduce the backload and report completion turnaround times. In addition, new toxicology equipment is being added to consolidate testing of various drug classes and to further improve efficiency. The medical examiner's goals are to reduce the number of open case reports to 550, which represents an optimal open caseload, and to close the majority of cases within 60 days. As a result of the previous investment, since the spring of 2023, the department has reduced the number of open case reports by 50%. The department will continue the progress it's made to date by using similar strategies, including focusing on filling vacant positions, utilizing contract pathologists to temporarily offset workload for staff pathologists, and building more efficiency and capacity in the laboratory. The department anticipates reaching its goal of completing most cases in 60 days by the end of this calendar year. The devastating impacts of fentanyl in our community cannot be overstated. As such, we are proposing additional funding to further support the department in returning to optimal performance levels in the coming year. San Diego County Fire delivers fire protection and emergency medical services across 1.73 million acres of unincorporated San Diego County. Its Emergency Medical Services Office is additionally responsible for oversight, medical direction, and management of the emergency medical services system to deliver timely, high-quality emergency medical services and specialty care to our community. Last fiscal year, the department opened its newest fire station in East Otay Mesa, which serves the growing southern region of the county and increases urban emergency response to the area. In addition, County Fire assumed responsibility for ambulance service for unincorporated communities, as well as the service areas of Alpine Fire Protection District and Valley Center Fire Protection District. The department currently has 23 ambulances in its fleet and plans to add more in the coming fiscal year. Emergency Medical Services provides ambulance services to the unincorporated area through a public-private partnership. We're also pleased to provide an update today on the American Rescue Plan Act funding that County Fire received to help support the negative impacts of COVID-19. Using these funds, County Fire allocated $4 million across 14 fire districts in the unincorporated area to support fire districts' costs incurred to mitigate COVID-19 and to provide a safer work environment for their staff. The equitable allocation of these funds across several fire districts helped ensure a large portion of the region received a share of that funding. Looking forward, County Fire will continue prioritizing their vegetation management program that reduces fire risk throughout the county along more than 600 miles of road. In addition, we're investing in improvements to Ramona Fire Station 80 and will begin design of a new fire training tower. A final highlight is County Fire's partnership with probation. These two departments have teamed up to launch a fuels crew training program for youth in long-term custody. This one-year training program will provide invaluable experience for in-custody youth who are interested in a future firefighting or land management career. Once youth have completed the program and met other criteria, they may become eligible for the state's seasonal firefighting classification or forestry technician series. These are career opportunities with livable wages from their first paycheck. The county is committed to improve community safety and well-being through supportive programs, communication, and collaborative partnerships. As part of our ongoing commitment to justice reform, the Public Safety Group departments and the Health and Human Services Agency have a proposed budget of over $230 million to continue focusing on prevention, diversion, and reentry programs and services collectively under the umbrella of Alternatives to Incarceration. The county's work on alternatives to incarceration relies on community engagement and evidence-based practices to build services that are effective and meet the needs of justice-involved people throughout our region. 8 community members, including social service providers, community advocates, and people with lived experience in the justice system, currently serve alongside public sector, health, and justice partners on the Alternatives to Incarceration Advisory Group, which guides the county's investment in justice system prevention, diversion, and reentry programs. The advisory group regularly facilitates community listening sessions to gather input that shapes the services and programs implemented through the initiative. To date, more than 160 community members have participated in 4 in-person and virtual listening sessions in 2024. The county is also in the process of onboarding consultants with lived experience in the justice system to guide the design and implementation of services for justice-involved and at-risk individuals. You will hear more from our justice and law enforcement presenters on the specific work being done by their departments, but here are highlights from some of our more collaborative prevention, diversion, and reentry programs. The Sheriff's Department and the Health and Human Services Agency will partner to establish a transition clinic pilot program in up to 2 primary health care clinics following the Transition Care Network evidence-based national model. Each clinic will connect a community health worker with lived experience of incarceration with justice-involved clients to build rapport and provide mentorship and guidance during their transition phase prior to and immediately after release from San Diego County jails. The program will help empower justice-involved clients to connect to needed health and social care services in the community upon reentry. We're also partnering with the Health and Human Services Agency on reducing the number of individuals determined to be incompetent to stand trial and hopefully better serve them in community-based behavioral health settings. In addition, the Public Safety Group has begun a 3-year pilot program to enhance services and support for human trafficking survivors by offering peer support navigators to strengthen connection to individualized services. And finally, using Prop 47 grant funding that runs through 2026, we're connecting justice-involved individuals who have significant needs and who are reentering the community with care-based services such as emergency and permanent housing, mental health treatment, substance use treatment, and connections to employment. Thus far, 90 individuals have been served through a new grant-funded program since services began in May of 2023. Throughout this important work, the Alternatives to Incarceration team will continue working closely with the Office of Evaluation, Performance, and Analytics and its agency partners to support outcome-based decision-making and our county's continued investment of justice reform services. In addition to the work just described, Public Safety Group departments used the budget equity tool to prioritize funding in support of programs and services designed to advance equity for the most impacted communities in the county. Here is a highlight of some of those investments. We're proposing $400,000 for animal services to hire 3 additional staff to operate a new mobile veterinary services unit that will focus on underserved areas of the unincorporated community. The mobile veterinary unit will help provide more equitable access to spay-neuter surgeries, vaccinations, microchipping, and basic pet wellness. Access to basic pet wellness services is increasingly urgent as a national shortage of veterinarians and vet techs makes basic pet care for pet owners more difficult and expensive to obtain. We're also providing $23.2 million recommended in funding towards county fires management of the 23 ambulances noted earlier to help ensure equitable levels of emergency medical services and improved health outcomes for residents in the unincorporated area. In addition, we are recommending over $1.2 million for probation to provide enhanced supportive services for at-risk youth in our community. The medical examiner is recommended to receive $1.3 million in additional funding to support their increased caseload due to the rise in accidental overdose cases that are impacting vulnerable members of our community and their families. Finally, we're also recommending $500,000 toward the gun violence reduction program to reduce suicide, domestic intimate partner violence, and community violence. Prevention strategies include a spectrum of actions designed to stop violence before it starts and actions that address immediate and long-term responses to violence. Community engagement was at the center of the Gun Violence Community Needs Assessment, which shaped this program. The Public Safety Group hosted 15 community listening sessions, forums, and presentations, and released 2 public surveys to better understand community perspectives, experiences, opinions, and impacts related to gun violence. Insights and feedback gathered through these engagement activities helped inform recommendations developed to reduce gun violence in San Diego County. Since fiscal year 2020-21, Public Safety Group staffing increased by 607 positions to a total of 8,077 for the upcoming fiscal year, which is an 8% increase over 5 years. The highest staffing increase was in fiscal year 2021-22, which saw an increase of 364 full-time employees. This was primarily due to new staffing for Rock Mountain Detention Facility, adding medical mental health staff in the sheriff's detention facilities to expand medical care and to enhance access to mental health care for persons in custody, including nurses and mental health clinicians, and the transfer of the Emergency Medical Services Unit from the Health and Human Services Agency to County Fire and the Public Safety Group. In 2022-23, there was an increase of 181 staff for various programs in public defender, probation, as well as in sheriff, which were funded by program revenue. And in 2023-24, the increase of 50 full-time employees was mainly for the district attorney, public defender, and sheriff, and were also program revenue funded with Prop 172 and the CARE Act. The Public Safety Group's budgeted increase by 34% since fiscal year 2020-21. This includes the positions mentioned in the previous slide, as well as negotiated labor agreements. In fiscal year 2021-22, we saw major investments primarily due to the addition of 364 full-time employees. This is also the year we established a budget for the Immigrant Rights Legal Defense Program, initially as a one-year pilot. Our fiscal year 2022-23 included funding for a twin-engine firefighting helicopter, as well as the addition of 181 full-time employees. The fiscal year 2023-24 budget included the addition of 50 full-time employees, as well as one-time expenses such as facility lease improvements to the North and South County Family Justice Centers, an upgrade to system infrastructure for the next generation regional communications system, and various other facility projects. Our fiscal year 2024-25 appropriation increase will be discussed on the next slide. The Public Safety Group's recommended budget is increasing by $55.6 million, which is a 2.1% increase for a total budget of $2.7 billion and 8,077 staff. The budget increase is driven largely by labor negotiations. The net addition of 12 staff and investments to improve our facilities, specifically in detentions, as well as funding the new ambulance services. In total, Public Safety Group departments are requesting 12 additional staff, which is a combination of adding 58 positions and reducing 46 unfunded and vacant positions. Of the 58 additions, 22 are revenue offset, with the remaining 36 positions funded with general purpose revenue. The proposed budget for the Department of Animal Services includes an increase of $1.4 million, mostly due to an increase in salaries and benefits, support for increasing animal care costs, and the addition of 3 staff years that will be dedicated to the mobile veterinary unit. The Department of Child Support Services has no budget or staff changes this fiscal year. The Office of Emergency Services increased by $1.5 million, primarily for one-time funding for facility maintenance projects. The Medical Examiner's Office includes an increase of $3.7 million, which reflects the addition of 1 staff for work funded by the opioid settlement, anticipated salary and benefit increases, as well as funds to support pathology, investigations, and toxicology. These increases will help the office continue to meet the increased caseload and service requirement demands experienced over the last several years. County Fire's increase of $24.1 million is primarily for ambulance services, which the county assumed responsibility for, and to continue the current level of support to fire and emergency medical services, for programs granted by CAL FIRE and Climate Investment Fire Prevention, and equipment purchases. The increased cost also supports the addition of 4 staff who will manage the administration and oversight of the ambulance services approved by the board last fiscal year. And finally, the Public Safety Group Executive Office has a proposed budget of $491 million, a $61 million decrease from the current year's adopted budget. The decrease of $61 million is largely due to completion of prior year one-time expenses, such as facility and IT projects funded with Proposition 172 funding. It should be noted that a huge portion of the $491 million proposed budget includes $68 million for contribution to trial courts and other special revenue funds, such as Proposition 172, with a budget of $398 million. The budget also includes the addition of one full-time employee for the gun violence prevention program, funded with public safety realignment. More detailed highlights of their respective budgets will be provided by the sheriff, district attorney, chief deputy public defender, and the probation chief. This chart shows a different view of how the Public Safety Group's proposed budget is distributed across our departments. As you can see, nearly 3/4 is related to funding of the criminal justice system. During the 5-year forecast exercise, the Public Safety Group departments initially submitted requests of more than $142 million in ongoing funds. The total new investments funded with general purpose revenue is $27.9 million. It should be noted that funds were insufficient to address the budget gap identified by Public Safety Group departments. Acknowledging that the needs exceeded the available general fund resources, the following strategies were implemented to mitigate the budget gap. Our departments continue to focus on their core public safety activities. This has included a deeper analysis of various revenue streams in order to use restricted trust funds and special revenue funds. We are also adjusting our timelines and program growth, including hiring and executing contracts. In addition, our departments have conducted business process improvement reviews. Some examples of those efforts include probation's reclassification of positions, as well as a schedule change that will soon be implemented to help address ongoing staffing needs, departments proactively seeking and receiving grants that support their work, and conducting a thorough analysis of potential fee increases within the Public Safety Group departments. In addition, investments by public safety departments that include program expansion and more than 60 full-time employees requested to meet the current operational needs have been suspended to subsequent years. The most significant action Public Safety Group has taken to solve our gap in order to fund areas of critical need is to use anticipated savings from vacancies and attritions with an average of 7.7% across the group. This revenue summary shows how Public Safety Group departments are supported by funding source category. Public safety activities as a local responsibility relies upon the county's general fund. 46% of the recommended budget is funded by general fund for both ongoing and one-time expenses. Federal and state revenue is our next highest revenue source, which includes the Homeland Security Grant Program for Sheriff and Emergency Services, as well as Title IV-D funds for Child Support Services. This category also includes revenues based on sales tax received by the state and allocated to Prop 172 special revenue funds and the 2011 public safety realignment revenues. Other financing sources are revenue transfers primarily to the general fund from another fund. Charges for services are primarily revenues in the Sheriff's Department for law enforcement services in their contract cities. Thank you, Chairwoman Vargas and members of the board. That concludes our overview portion of the presentation, and we will have our 4 remaining Public Safety Group departments after this presentation, beginning first with Sheriff Kelly Martinez, but we'll pause here for any questions you may have. We'll start with Sheriff Martinez. Thank you.
Good afternoon, everyone. It's great to be here. Again, good afternoon, Chair Vargas and members of the board. I appreciate the opportunity to be here today to highlight the work of the Sheriff's Department and share with you our budget priorities. I'd like to start today by sharing the main priorities that are and will drive our budget needs. As a sheriff, I've taken stock of long overdue infrastructure needs, and I recognize that all our communities are not receiving the same level of service. The unincorporated communities of San Diego County do not receive the same level of public safety service as those who live in the cities of San Diego County. An area where we need to focus investment is in the North Inland region, specifically Fallbrook, Rainbow, and Bonzo, Valley Center, and Ramona. And next, at the Vista Detention Facility, which has reached its end of useful life and will need a large investment to be remodeled or replaced. To properly serve the Northland Inland communities of San Diego County that border Riverside County, extend south to Escondido, and reach to Palomar Mountain and the La Jolla Indian Reservation, we will need to build and staff a sheriff's station on the 18-acre parcel that was purchased about 2 years ago and is situated at the I-15 and Highway 76. The station will address the population growth in the region, the span of control and area of responsibility of sheriff's personnel, as well as providing a work site for sheriff's personnel living in Riverside County who cannot afford to live in San Diego County. The location of the proposed sheriff's station reduces staff commute times, driving time to training, and would create support and resources that are not currently realized to our rural, tribal, and farm communities. We will add resources to support fighting wildland fires and 24/7 law enforcement resources. By replacing the Ramona substation, we will provide residents in that community and our staff with a fully functioning station that is long overdue. The Vista Detention Facility renovation and replacement is expected to cost at least $400 million, but it must be addressed. We continue to study what a modern intake, booking, and detention facility and reentry facility will look like, but we know that we cannot continue to house and staff a facility with the expansive needs of the existing site. The Vista Jail was built and added to in phases, with parts of the facility first built in the 1970s. Decades of changes in legislation, medical, and mental health needs of incarcerated persons, and the types of offenders we now house make the current facility untenable. We've significantly moved the needle toward improved and enhanced care through policy changes and program development, and we continue to make progress in staffing vacant positions. We will meet our goals of improving the county's jails, which include meeting current regulations and legislation and forecasting changes that will come in the future. We recognize that our ability to fill our vacant positions, particularly in the jails, depends on thinking differently. We've identified that it is easier to hire people to staff these positions in the law enforcement classification than in the detentions classification. We can hire, train, and deploy law enforcement deputies more quickly than the detentions deputies, and it is our goal to fully staff our jails. This will reduce the mandatory overtime, workload fatigue, and other potentially negative effects of short staffing. Law enforcement deputies can be deployed in the jails, courts, and patrol, depending on our needs. Right now, our biggest staffing gap continues to be in the jails. Because of all these considerations, we have reclassified positions to help us fill our staffing needs with available applicants in our candidate pool. This change will increase our salaries and benefits expenditure, but will reduce overtime expenditures with the benefit of healthier staff and workplace environments. This is a brief overview of what we do. The Sheriff's Department provides general law enforcement, detention, court security, civil process, regional investigative support, and tactical emergency response for San Diego County. This includes 9 contract cities, the Grossmont-Cuyamaca College District, 18 Indian reservations, 7 jails, 18 patrol stations, 6 courthouses, and other regional commitments. The Sheriff's Department provides numerous services through programs, outreach, and events. Shown on the slide are a snapshot of these services provided to our communities and to those in our care. Some services to highlight include our Respect Project for Youth, the Spanish Academy, and Peer Reentry Leadership Academy for our incarcerated population. Over the course of the past year, the Sheriff's Department has continued its commitment to improving our county's jails. These include a near completion of the Rock Mountain Detention Facility renovation, which has allowed us to partially occupy the facility and better serve our incarcerated population with a modernized facility with ADA compliant housing. We've begun renovations in our George Bailey Detention Facility and anticipate to complete those in 2025. This will include the elimination of triple bunks, upgraded security, major system upgrades, and improvements in the housing units. We have incorporated significant changes to improve overall health care and treatment for those in our custody, We expanded rehabilitation opportunities and reduced returns to custody. The ADA Compliance Unit became operational and assists the department in creating locations accessible to those needing accommodations. The Sheriff's Department began its medication-assisted treatment program, known as MAT, in January of 2023, and we have had over 1,078 participants to date. The MAT program participants have reported that they are more likely to engage in treatment services in the community or correctional facilities because of their experience in our MAT program. We've been innovative with the technology advancement deployed in our jails. For example, we have begun implementing a body-worn camera program in our detention facilities, which we anticipate to be fully deployed in 2025. Additionally, we began using body scanners during facility searches to discover contraband and mitigate the risk to our incarcerated persons. We've upgraded our camera and video infrastructure to include 350 facility cameras for increased security. We've also installed smart communication phones to connect incarcerated persons with their family and friends. These smart communication phones are an easy-to-use online communication system. We invested and upgraded our wireless internet and microwave connectivity in our detention facilities to support these technology deployments. The Blue Envelope program was implemented at all San Diego Sheriff stations, all 14 law enforcement agencies in San Diego County, and includes 34 community partners. This program is designed to promote inclusivity and serve as an enhanced communication awareness tool between law enforcement and community members diagnosed with a condition or disability such as autism spectrum disorder, dementia, anxiety, or other conditions that might require additional accommodations or awareness during a law enforcement response. The department's Homeless Assistance Resource Team, or HART, partnered with the San Diego Regional Task Force on Homelessness to kick off the first Law Enforcement Summit on Homelessness in August of 2023. HART was also instrumental in the expansion of San Diego County's homeless resource fairs that bring together Homeless Court, California Department of Motor Vehicles, Detox and Substance Use Disorder Services, County Assessor, and Child Support Services, while also offering showers, clothing, and haircuts. These resource fairs increased in frequency from quarterly in 2022 to monthly in 2023. The Sheriff's Spanish Academy held its first South County Academy at Spring Valley Community Center during the fall of 2023. On May 7th, we held the graduation of our most recent academy with over 70 graduates. We've hosted 7 academies since the inception of this program that engages with our Spanish-speaking community members in conversations about important public safety topics like when to call 911 and what to expect during a traffic stop. On April 20th, we held our first gun safety event on an Indian reservation at the Paula Band of Mission Indians Administrative Building, where we collected 56 firearms and gave 76 gun safes and 49 gun locks to the community. This was our 12th gun safety event since we began the program in 2021, and we have collected and taken off the streets a total of 2,348 firearms, and we plan to continue our partnership with the District Attorney's Office and the communities of San Diego County to hold these events. The next 2 slides include our operational plan goals that are aligned to the county's strategic initiatives. To enhance the recruitment experience for our candidates, the department launched its hiring app this April. The launch of the hiring app both furthers the sustainability goal of virtual service delivery and the empower goal of providing opportunities for engagement for employees. This first-of-its-kind hiring app will allow candidates to track their application, get updates on their background process, and communicate directly with our personnel to expedite document receipt and information notifications. The app is also being developed for current employees to facilitate their career development and pursuit of promotional opportunities. Our department also incorporates budget equity to prioritize funding and support of programs and services designed to advance equity for the most impacted communities in the county. Our programs and outreach continue to expand with an eye to enhancing our service delivery and engagement with our communities. We firmly believe in the prevention, diversion, and most importantly, mentorship of juveniles throughout our region. The Respect Project exemplifies our commitment to this ideology and one of the cornerstones of our juvenile outreach. It furthers the community goal of expanding programs and outreach with our diverse communities. We continue to pursue the expansion of this program to the East and South County to bring its positive impact and outreach to more youth in the region. This past year, Vista Patrol has dedicated a deputy to assist with getting Vista youth into our Respect Project. Additionally, the Paula Youth Center coordinator has assisted youth from the Paula Indian Reservation to participate in the Respect Project by providing transportation and support to attend the academy. The past fiscal year, the Respect Project has served over 100 students and their families. I'd like to highlight the significant budget adjustments for next year. There's an increase of $56.1 million associated with the required retirement contributions and negotiated labor agreements. This will be funded by general purpose revenue of $19.2 million and program revenue of $11.1 million. The general purpose revenue amount includes a reduction of $25.7 million in vacancy savings to reflect positions that are anticipated to be vacant and to leverage attrition, and to create budget capacity to support existing county priorities. The $15.5 million increase will be used to support the medical and mental health services contract, which will be funded by a general fund balance. Improving the jails remains one of my top priorities. This includes making critical renovations at the George Bailey Detention Facility of $10 million for increased cost for security and additional ADA. Replacing and repairs to drainage and HVAC, $17 million for San Diego Central Jail to replace an outdated command center long over its service life, which could cause a catastrophic failure if it is not replaced, and $11 million to comply with the Americans with Disabilities Act through the detention facilities. The total cost of $38 million would be funded by $21.6 million in general fund balance and $16.4 million of one-time general purpose revenue. We've identified $12.9 million in major maintenance projects throughout the facilities, which will be funded by general fund balance. These funds will support major facility improvement projects, primarily in the detention facilities. There will be an increase of $6 million associated with the ongoing facility, fleet, and information technology costs, which will be funded by vacancy savings. The recommended operational plan for the Sheriff's Department is $1.3 billion for the general fund and non-general fund. This is an increase of 5.3%, or $64.7 million of the total budget from the current year. This chart includes the staffing and budget for the general fund only and is displayed by bureaus. The operational plan includes staffing of 4,702 employees, which is a net decrease of 46 staff years from the current year. Previously, the department froze vacant positions, which became unfunded due to the economic impacts of COVID-19, and kept them on the books, so to speak. We made the decision to permanently reduce 35 of these vacant and frozen positions since there was no longer any funding for them. An additional 6 staff years will be deleted in order to fund the ongoing costs of the wellness unit, which we only received one-time funds for to establish the unit from the Board of State and Community Corrections. And 5 staff years is being reduced due to restructuring efforts in the detention facilities, communications, and specialized units. The reduction of these positions does not impact our services or anything that we're doing for our communities. The budget for non-general funds is $23.1 million, which includes the asset forfeiture program, which is used to account for funds collected from seized assets, the jail commissary enterprise fund, which is used for operation of the sheriff's commissary. The funds are used to purchase goods for sale to incarcerated people in our jails. The Sheriff's Incarcerated People's Welfare Fund, which is used for the benefit, education, and welfare of incarcerated persons housed in the detention facilities, and the county service areas, which is used to account for costs associated with the regional communication system. There are no positions included in these funds. In developing the budget, there was a gap between requests and available resources. Various mitigation strategies were applied to balance the budget to ensure no service level impact and maintenance of core services. The department used anticipated savings from vacancies. We maximized available restricted resources, delayed requests for additional staff, and bridge funded the increases in healthcare costs to ensure a balanced budget. As we plan for fiscal year 25-26, operational plan and beyond, it is important to note that one-time funds to support ongoing costs is not sustainable. In addition, the department cannot sustain the growing amount of negative salary adjustment, which is using potential savings from anticipated vacancies in the environment when costs are increasing. It's my goal to equip my staff, provide desirable work locations for my people, and create healthy workspaces. Supporting the physical, mental, and emotional health of sheriff's employees is fundamental to building safer communities and a strong workforce. With these investments, all my staff are better able to positively interact and deliver quality service to everyone in San Diego County. Chairwoman Vargas, members of the board, this concludes my presentation, barring any questions.
Thank you. Before the sheriff departs, on behalf of Chairwoman Vargas, any supervisor have any questions for the sheriff? Supervisor Montgomery Stepp.
Thank you so much. Thank you, Sheriff Martinez, for the presentation. I can see the slides, but I can't quite see you, so just bear with me. Just really quick, I wanted to ask about the strategic plan that you had, and I just wanted to make sure, as I ask my questions, that the strategic plan is somewhat connected to some of the recommendations from the state audit that we had a couple of years ago.
Okay. So, yeah, the state audit really, we've accomplished most of the goals of the state audit right now. The remaining goals or the remaining recommendations of the audit really focus on infrastructure and staffing. So the infrastructure needs of our facilities are being met through the renovations that we're currently working on at all of our facilities, and then the plan moving forward with the Vista Jail to enhance mental and medical health services in our facilities primarily is where those recommendations lie at this point.
Okay, and so what were some of the recommendations that have already been completed then?
So the medical and mental health screening at intake was a primary recommendation, which we are doing. We've also added urine screening at intake, which helps us with the understanding what substances are in an individual's system when they come into our facilities so that we can start the substance treatment or withdrawal treatment protocols more immediately. And that was one of the recommendations, to see a doctor and a psychiatrist sooner, which is occurring already. We've expanded the MAP program. I believe that was one of the recommendations. Some of the recommendations, as I said, that are remaining are really to have larger treatment areas. One of the things that is very notable in our facilities is there's not space for psychiatric examinations that allow for privacy of the patient. The same with, this is particularly at intake, we just don't have the spaces that we need to provide for that.
Okay, and so the budget that you're putting forward now, essentially based on what's in the budget book and your presentation, do focus on those additional recommendations from the audit / strategic plan?
Yes. There's a lot in the budget that not only improvements based on the audit, but we really want to take the care of the individuals in our custody much further than what the audit spoke to. So a lot of what we're doing is really focused on just better health care and treatment overall. We're adding cost to our healthcare contract, which you saw in our budget, as well as a number of other things, hiring people, the mental health clinicians, all of those things are really important to us in the treatment of people in our custody.
Okay, good. I'm glad to, I know we've discussed this before, but glad to hear you say that, you want to go beyond that because we're still, the recording of our jail deaths is still really high, or the rates are still really high. So anyway, want to continue to work on that together. Thank you for your commitment. And then we will continue to meet and monitor the situation. Thank you very much.
Thank you.
Thank you. Any other additional questions? Supervisor Desmond.
I just have a quick comment, Sheriff. I appreciate all that you do, and I know it's not an easy job, but I think you're doing the best you can with the resources you have. And I wish we had more and more and more, but we don't, so thanks for the job you're doing.
I appreciate that, Supervisor. Thank you.
Thank you. Not seeing any additional questions, we'll now hear from the District Attorney, Summer Stephan.
I don't need the PowerPoint up. I'll ask for it when I'm ready. So just so that you can have a sigh of relief, the lawyer is going to speak for shorter than most of the non-lawyers this morning, so that you will get lunch. Good afternoon, Chairwoman Vargas, supervisors, board, staff, and community. As a district attorney for San Diego County, I serve every one of your districts. I'm one of the unique positions that has all 3.3 million people that call San Diego home or visit San Diego or immigrate to San Diego or end up on our streets. I do this through 7 offices with dedicated professional staff. During the pandemic, this staff continued to work every single day because crime did not stop. They had to actually be with the victims of crime. They had to be at the scenes. They had to be at the autopsies. And they had to show up for justice in our community. And at that time, every department was increasing in staff and money because they asked for it. And because they earned it, they needed it. But we realized that the county did not have unlimited resources, and I stood here and told you that I have a plan that will allow us to dual fill certain positions to deal with the hundreds of cases of backlogged sexual assaults and murders, something we've never dealt with in our history. We've never had a pandemic, as you know, during our lifetimes. And my staff trusted me when I stood here and did that. And that's exactly what we did. We dual filled those positions to be fiscally responsible, and when the backlog went away, we allowed retirement of those additional positions in order to remain within the budget and in order to make sure that the county continues its services to people impacted everywhere, especially the health services needed. Of course, I thought that the county was going to remember that when we ask for things, we actually need those things. We do not just come up with numbers and things that we ask for without the numbers, without the ability, the need for those resources. So this team that continued to do the work, and I'm going to go through some highlights, just a few highlights. Maybe one highlight is that we were named one of the best 5 district attorney's office in the nation. And even more important, if you at all judge budgets by performance, is the fact that the criteria used for this judgment by Justice Jackson, where Justice Jackson, the one who tried the Nuremberg trials, his criteria, which is internal integrity, external integrity, an internally functional office that doesn't result in lawsuits to the county, an externally functional, competent office that doesn't make mistakes with not one single payout by the county for mistake, for negligence, for not checking out an alibi, making sure we don't have wrongful convictions, that we take care of justice and our power and our responsibilities. Not one. Keeping the community safe and fidelity to the rule of law, which benefits every one of the people that work in your communities. I challenge you to ask your staff about how many complaints you get that don't get responded to immediately by the DA's office. Every crime victim from your area getting what they need. With the number one responsibility, I dare to say, for society is justice and community safety. Nothing thrives, nothing without safety. Not a child, not an adult, not a senior. We know from having the daily experiences of looking in the eyes of victims that are ripped apart by crime, this fact about the need for safety. It's an essential human right, and it's a right that must be safeguarded and prioritized. So you can imagine when I went to my team, because I've grown up with them. I've been there 34 years, 28 years as a line deputy. Now in my second term, they trusted me because I have never not told them the truth. Never, not once. And when I went to my team, all 1,000 of them, and informed them the county is cutting everybody across the board by at least 4% because of a dire financial situation that they're in, and that our budget is going to be reduced by $18 million. And you know how you've been working around the clock, and you know how I have several district attorneys out on stress leave and emotional leave. Why? Because they have to view children being molested and sexually assaulted in images. They have to be there and see the pain. They don't get to phone it in. They don't get to telework. They don't get that. And when I have to tell my team that this is an across the board, and they read the operational plan and see that the DA's office was devalued and defunded by $18 million, while many areas grew, you will not hear me, and you will never hear me talk about your decisions, about that the people the operational plan gives money to shouldn't have that money. I respect all my fellow hard workers in the county. But this translates into 100 frozen positions to avoid layoffs. This is 10% of my workforce. This means I'm going to go to my team and ask them to work harder with less, to keep working, just like I asked them during COVID. Don't worry about it. The county has our back. So here's just a few things your county DA's office has been able to accomplish. Oh, I mentioned that we were the top 5 DA's office in the nation, a moment of pride for the entire Board of Supervisors and all our partners in law enforcement. Did I mention that in December of 2023, we received the top public service award by the Department of Justice in the nation for the service of justice? We fully implemented everything we promised this board. The DA Juvenile Diversion Initiative. 500 kids were removed from the criminal justice system, meaning a court didn't see them, a public defender didn't see them. We managed a population that was given to National Conflict Resolution Center with 50 community-based, culturally competent providers with an 80% success rate and a 7% recidivism rate. These are lives of kids restored. We're now embarking on the same journey for a countywide transitional age youth diversion initiative, so that our 18 to 23-year-olds will also get the benefit of making mistakes without having their lives destroyed. Fentanyl, we rose to the task. We are the #1 entry point for fentanyl. But what do you see in the numbers? 77,000 died across the United States in 2023 from fentanyl. San Diego County being the largest entryway, because of doubling down on drug dealers, doubling down with our community partners, prevention through the schools that we embarked on, everything that we partnered on with Narcan and everything else that the county's doing, the medical examiner's numbers are going to show this year that there's at least 65 lives, that the overdose death went from 815 to around 750, that 12 kids died, with the youngest being 13, and now it's 2. Because early in the morning, late at night, the team is working around the clock, partnering with the community. How about school threats? Do you know that while everybody sleeps, the DA's office leads the best school threats program in the nation? Do you know because of that, I was just in Washington, D.C., the only prosecutor in the nation to speak about our school threats protocol with Parkland families, with Uvalde families. The first time Department of Justice dedicated a wall to survivors of mass shootings, they wanted to learn what we're doing in San Diego. And they learned that we have a team that around the clock works with law enforcement when there's a threat, brings all the resources for gun restraining orders, for removing weapons, for mental health services that are embarked. Do you know that just in the last 2 months there were 2 potential shootings that were close to coming live? You don't hear about it because these are juveniles. We can't name them. But they'd already garnered the weapons. They'd already had a plan. They had a date specific when they're going to shoot up a school. This takes patience. It takes a team that is not frayed at the seams, a team that is able to think and to do our job to save lives. How about human trafficking? Should I remove people from the human trafficking task force? Let me read you one little note that a 13-year-old that was just recovered by our task force with our investigator, Katie, on that team. She built a bond with Katie, and here is what she told her. She texts her late at night, "Hey, Katie," first name, because this is what we ask our team, to be humble, to be there for our victims. "Hey, Katie, I recently moved with my grandma. Now, to be completely honest, I've been having a hard time dealing with all the trauma and flashbacks from things I went through. I want to find a better way to cope with it. Is there any way I can get into an online therapy for girls that were trafficked?" Here's Katie. "Hi, of course, let me see what I can do for you," etc., etc. "Thank you so much. I appreciate everything you and STPD has done for me. I know I don't say it, but you guys really did save my life." This is just one person. If we remove that resource so that we can run around like chicken without a head in order to serve a community, that is not right for the 13-year-olds out there. How about our wage theft program, those greedy employers that aren't paying wages, working with the county's labor? Do you know that we did the first felony wage theft prosecution under new law? We did 4 in 2023. Again, fighting for our most vulnerable, people whose paychecks are being cut, people that are not being protected by greedy employers. How about our homeless pop-up courts that served, because we keep numbers on everything. I know some supervisors are asking for numbers. Good for you. We keep every number of everything we've done. 2,705 people in 27 pop-up courts that are a collaboration with the county came through. What about our Family Justice Center? 4,800 victims walked through the door since July 5th of 2022. Half of them came back for 4 sessions. Do you know what the science says about what the best criminal justice reform is? The best criminal justice reform is to get to a child early before they get into a cycle of violence. Those kiddos that are getting CFSTI from rabies and Palomar, understanding that love shouldn't hurt, that people shouldn't beat and kick and stab and strangle to show love in domestic violence and child abuse, that is what we're doing. And that's why we're so excited to open the South Bay Family Justice Center. It's demolished. The site has been picked, but what choice do I have? Do I build a South Bay Family Justice, or do I pay my employees so they don't get burnt out? What else? There is a lot more here that I want to talk to you about. But I do want to stop for a moment and say that as soon as I read the operational plan, and I contacted Chairwoman Vargas and contacted our CAO and our Chief Financial Officer, Ebony, they took action. Sarah and Ebony had at least 2 meetings with my team. Something was missed. I'm going to give the benefit of the doubt that none of you supervisors directed this cut for me. I'm going to give the benefit of the doubt that something went awry. I don't know where. I have no idea. I don't want to say bad things in public. But this must be reversed, and I appreciate everything that everyone is doing to work with us, but this has demoralized my team. If you can imagine, after I told them what I told them about this being a cross-cut, how devalued, demoralized my team feels, how let down they feel after all the work they've done. So I can run through my 7 slides, but they say exactly what I just told you. I'm happy to run through it if you'd like.
Thank you, District Attorney Stefan. We'll turn it to our CAO, Sarah Gussie.
Thank you so much, District Attorney Stefan. Thank you, Summer. I take the responsibility for purposes of being able to work with you and partner with you as we move forward. We have a change letter process, and I absolutely can share with you that this was not directed by any of the board members. These were decisions that we were making as we were balancing the budget based on the presentations that you have heard, as well as what's to come for purposes of some of our other groups. Thank you for centering us on the work that you and the team achieves on a daily basis. And as part of the change letter, we will be proposing some changes and then working with you for a longer term strategy on how to stabilize and bring you back to where you provided as it relates to the funding gaps. We are absolutely committed. Ebony, Holly, I'm committed. The entire team is committed to working with you and having a proposal that meets the needs and then also can be presented as part of the change letter process and the budget process as we move forward. Thank you.
Thank you.
On behalf of Chairwoman Vargas, we'll turn to our colleagues. Supervisor Anderson.
Thank you, Madam Chair. I just want to let you know that I value you. I value your team. Your numbers speak for themselves, and the fact that we can feel safe at night knowing that you and the sheriff are working so hard on our behalf. So I look forward to mending this fence and moving forward, because I do value the importance of the work that you do.
Thank you, Supervisor.
Any other questions for the district attorney from supervisors? Supervisor Montgomery Stepp.
Thank you so much. I just want to say thank you to Madam District Attorney for the presentation and the level setting. I just, for all of county staff and our elected officials as well, I think part of my job is to ask questions, and so I will continue to do that through our budget processes, but I in no way mean to disparage any of the work that anyone is doing. I'm just always shooting for us to do even better, because I believe in San Diego so much. And so I really appreciate the presentation and not having to use the slides, because you know your work so well, and you know what your staff is doing to make this region a better place. So thank you very much. I just wanted to make sure my questions are not misinterpreted for anything at all, other than for us to reach the same goals that I think we all have. Thank you.
Thank you, Supervisor.
Vice Chair Lawson-Remer.
I just wanted to say I appreciate the presentation, and I look forward to, Sarah, your work to be able to come back to us with a change letter that I think will hopefully clearly address some of the challenges. So thank you.
Thank you.
Supervisor Desmond.
Well, I just want to say thank you, Summer, for your presentation and your passion in your delivery, and for not doing a PowerPoint. But it's tough up here what we do, and it's tough what you do as well. But we got to balance what we have, and everyone is valued. And unfortunately, across the board cuts are not always the best way to go about things, and happy to revisit that and take a look at what we can do. You're absolutely valuable, but so is everybody in the whole enterprise is. So I appreciate it.
As they should be. Thank you, Supervisor.
Thank you.
Thank you, and on behalf of Chairwoman Vargas, I'll read a statement. It reads, I appreciate you reaching out directly. I'm grateful to our team for looking into this so quickly and for the partnership. I'm looking forward to the change letter and appreciate the equity-minded work.
Thank you. Thank you, Chairwoman. Thank you, Chairman. Thank you, Board, and thank you for listening to me clearly. Thank you very much. Thank you, everyone.
Thank you. And with that, the board will take a 30-minute lunch break and continue with the budget presentations when the board returns. The board is in recess until 2:30. Board is in recess until 2:30. Thank you.